As India looks towards faster economic growth, maintaining the health and productivity of its working population is key. With the Make in India campaign, the Indian government aims to transform India into a global design and manufacturing hub. Along with that, there must also be an increased emphasis on employee health at workplaces. 2 in 3 Indians are impacted by diabetes, cancer, heart diseases, or other non-communicable diseases. When compared to other developed countries, the onset of these conditions is at least a decade earlier among Indians. One smart way to contain the damage caused by NCDs is prevention through health education and lifestyle change. People spend more time at work than they do at home, which is why workplaces become key platforms in enabling lifestyle change. Arogya World started its Healthy Workplaces program in 2012 to leverage the workplace as a platform for NCD prevention. We conduct meticulous audits of workplaces to evaluate their health standards and recognize companies as healthy workplaces at annual conferences where best practices are also shared. The Healthy Workplace criteria, co-created with industry, are organized in 3 levels: bronze, silver and gold, and includes guidelines such as no tobacco use policy, easy access to healthy foods, and opportunities for physical activity. There's also a platinum certification reserved for exemplary workplaces, which is a data-driven leadership initiative. At this level, Arogya World helps in tracking the extent to which employee health has actually improved as a result of the various health initiatives and programs in the organization. Once we evaluate the level of health standards being maintained at a workplace, we conduct lifestyle modification classes, educational webinars, and Maithali programs to help employees make sensible lifestyle choices. Through these measures, we also enable workplaces to level up their health standards. In 2020, Arogya World launched an extensively researched mental health criteria as a part of its Healthy Workplace framework to help corporates address employee mental well-being in a structured manner. As of 2020, Arogya World has recognized about 145 companies impacting the lives of more than 3.1 million people. We couldn't have achieved this milestone without the able support of numerous companies, like-minded agencies and foundations. We are happy for this support and grateful for the partnerships. With our emphasis on clear benchmarking criteria, rigorous assessment process, great conferences, and our team's passion to improve the physical and mental health of working Indians, Arogya World has definitely advanced the dialogue on workplace health in India. As India looks towards faster economic growth, maintaining the health and productivity of its working population is key. With the Make in India campaign, the Indian government aims to transform India into a global design and manufacturing hub. Along with that, there must also be an increased emphasis on employee health at workplaces. 2 in 3 Indians are impacted by diabetes, cancer, heart diseases, or other non-communicable diseases. When compared to other developed countries, the onset of these conditions is at least a decade earlier among Indians. One smart way to contain the damage caused by NCDs is prevention through health education and lifestyle change. People spend more time at work than they do at home, which is why workplaces become key platforms in enabling lifestyle change. Arogya World started its Healthy Workplaces program in 2012 to leverage the workplace as a platform for NCD prevention. We conduct meticulous audits of workplaces to evaluate their health standards and recognize companies as healthy workplaces at annual conferences where best practices are also shared. The Healthy Workplace criteria, co-created with industry, are organized in 3 levels: bronze, silver and gold, and includes guidelines such as no tobacco use policy, easy access to healthy foods, and opportunities for physical activity. There's also a platinum certification reserved for exemplary workplaces, which is a data-driven leadership initiative. At this level, Arogya World helps in tracking the extent to which employee health has actually improved as a result of the various health initiatives and programs in the organization. Once we evaluate the level of health standards being maintained at a workplace, we conduct lifestyle modification classes, educational webinars, and Maithali programs to help employees make sensible lifestyle choices. Through these measures, we also enable workplaces to level up their health standards. In 2020, Arogya World launched an extensively researched mental health criteria as a part of its Healthy Workplace framework to help corporates address employee mental well-being in a structured manner. As of 2020, Arogya World has recognized about 145 companies impacting the lives of more than 3.1 million people. We couldn't have achieved this milestone without the able support of numerous companies, like-minded agencies and foundations. We are happy for this support and grateful for the partnerships. With our emphasis on clear benchmarking criteria, rigorous assessment process, great conferences, and our team's passion to improve the physical and mental health of working Indians, Arogya World has definitely advanced the dialogue on workplace health in India. As India looks towards faster economic growth, maintaining the health and productivity of its working population is key. With the Make in India campaign, the Indian government aims to transform India into a global design and manufacturing hub. Along with that, there must also be an increased emphasis on employee health at workplaces. 2 in 3 Indians are impacted by diabetes, cancer, heart diseases, or other non-communicable diseases. When compared to other developed countries, the onset of these conditions is at least a decade earlier among Indians. One smart way to contain the damage caused by NCDs is prevention through health education and lifestyle change. People spend more time at work than they do at home, which is why workplaces become key platforms in enabling lifestyle change. Arogya World started its Healthy Workplaces program in 2012 to leverage the workplace as a platform for NCD prevention. We conduct meticulous audits of workplaces to evaluate their health standards and recognize companies as healthy workplaces at annual conferences where best practices are also shared. The Healthy Workplace criteria, co-created with industry, are organized in 3 levels: bronze, silver, and gold, and includes guidelines such as no tobacco use policy, easy access to healthy foods, and opportunities for physical activity. There's also a platinum certification reserved for exemplary workplaces, which is a data-driven leadership initiative. At this level, Arogya World helps in tracking the extent to which employee health has actually improved as a result of the various health initiatives and programs in the organization. Once we evaluate the level of health standards being maintained at a workplace, we conduct lifestyle modification classes, educational webinars, and Maithali programs to help employees make sensible lifestyle choices. Through these measures, we also enable workplaces to level up their health standards. In 2020, Arogya World launched an extensively researched mental health criteria as a part of its Healthy Workplace framework to help corporates address employee mental well-being in a structured manner. As of 2020, Arogya World has recognized about 145 companies impacting the lives of more than 3.1 million people. We couldn't have achieved this milestone without the able support of numerous companies, like-minded agencies, and foundations. We are happy for this support and grateful for the partnerships. With our emphasis on clear benchmarking criteria, rigorous assessment process, great conferences, and our team's passion to improve the physical and mental health of working Indians, Arogya World has definitely advanced the dialogue on workplace health in India. As India looks towards faster economic growth, maintaining the health and productivity of its working population is key. With the Make in India campaign, the Indian government aims to transform India into a global design and manufacturing hub. Along with that, there must also be an increased emphasis on employee health at workplaces. 2 in 3 Indians are impacted by diabetes, cancer, heart diseases, or other non-communicable diseases. When compared to other developed countries, the onset of these conditions is at least a decade earlier among Indians. One smart way to contain the damage caused by NCDs is prevention through health education and lifestyle change. People spend more time at work than they do at home, which is why workplaces become key platforms in enabling lifestyle change. Arogya World started its Healthy Workplaces program in 2012 to leverage the workplace as a platform for NCD prevention. We conduct meticulous audits of workplaces to evaluate their health standards and recognize companies as healthy workplaces at annual conferences where best practices are also shared. The Healthy Workplace criteria, co-created with industry, are organized in 3 levels: bronze, silver and gold, and includes guidelines such as no tobacco use policy, easy access to healthy foods, and opportunities for physical activity. There's also a platinum certification reserved for exemplary workplaces, which is a data-driven leadership initiative. At this level, Arogya World helps in tracking the extent to which employee health has actually improved as a result of the various health initiatives and programs in the organization. Once we evaluate the level of health standards being maintained at a workplace, we conduct lifestyle modification classes, educational webinars, and Maithali programs to help employees make sensible lifestyle choices. Through these measures, we also enable workplaces to level up their health standards. In 2020, Arogya World launched an extensively researched mental health criteria as a part of its Healthy Workplace framework to help corporates address employee mental well-being in a structured manner. As of 2020, Arogya World has recognized about 145 companies impacting the lives of more than 3.1 million people. We couldn't have achieved this milestone without the able support of numerous companies, like-minded agencies and foundations. We are happy for this support and grateful for the partnerships. With our emphasis on clear benchmarking criteria, rigorous assessment process, great conferences, and our team's passion to improve the physical and mental health of working Indians, Arogya World has definitely advanced the dialogue on workplace health in India. As India looks towards faster economic growth, maintaining the health and productivity of its working population is key. With the Make in India campaign, the Indian government aims to transform India into a global design and manufacturing hub. Along with that, there must also be an increased emphasis on employee health at workplaces. 2 in 3 Indians are impacted by diabetes, cancer, heart diseases, or other non-communicable diseases. When compared to
Good morning, everybody, and a virtual warm welcome to you all. I'm Soumya Prabhakar, and a little bit about myself and my background is I have a stint in corporate HR. I worked with the nonprofits, and currently I'm heading corporate affairs at a public policy think tank. Alongside, I've seen what's benefited most is keeping track of my fitness goals. So I pursue running, yoga, and cycling, and it has definitely influenced the way I think, I deal with situations, and of course, help me stay calm and happy. So now, before we get started for today's event, some hygiene factors for everybody to follow. There's a big marker thing that you will see on your gallery view. In case you want to view the video, you need to click on it and press on the audio button. And otherwise, you will see us all on the screen, and the entire virtual event is going to be seamlessly operated from our side. So while we get started, a little bit of an introduction to what's holding us together for this morning. So, what a year, right? 2020 has been. If ever there has been a year of focus on physical, emotional, and psychological needs of employees, I'm sure you'll all agree it's 2020. The COVID-19 pandemic has been emotionally challenging for many people, changing day to day life in unprecedented ways. There's a lot of ambiguity on the nature of new normal, and it has given that change is probably the only constant going ahead. So, how is corporate India preparing itself for the future? All sections of society, including employers and employees, need to play a greater role to protect themselves and each other and help prevent further spread of the disease. In the new normal, we need to create work and workplaces that will safeguard employees and give them the confidence that their workplaces are safe places to return to. Business leaders need to consider employee health and well being at the same level as their other key business priorities. This year, in its eighth edition of Arogya World Healthy Workplace Conference and Awards, Arogya World is felicitating 14 organizations which have been recognized as healthy workplaces. Our congratulations to them on this occasion, and they're all with us, so we're happy about it. This conference also brings together industry leaders from various sectors who have successfully turned the theory of well being into practice, which is so hard to do. The Arogya World Healthy Workplace family now spans over 145 companies, employing over 3.1 million persons. Over the course of the day, some of these practices will be shared. We are sure these lessons will inspire and support you in your endeavor to prioritize health and well being on your corporate agenda, knowing it's good for businesses as well. Now, let's begin the day. So, to kick us off this morning, we have Dr. Sushila Venkatraman officially opening Arogya World's virtual conference and awards event. Just a little bit of an introduction to Dr. Sushila. She is the former Chief of Technology at the Asian Development Bank. She has over 25 years of consulting experience, is a regular speaker at major conferences, and writes frequently on topics in healthcare and development. She sits on the boards of Unnati and IIT Alumni Association, Bangalore. She is the chair of Arogya World India Trust. Now, I call upon Dr. Sushila to welcome everyone and provide the opening remarks. Over to you, Dr. Sushila.
Thank you, Soumya, for that introduction. I want to start by saying welcome to this Healthy Workplace Conference. I'm very happy that we have so many of us joining today. You know, every year we normally do this event around the World Diabetes Day, which is, as we all know, the 14th of November. This day was instituted basically to create awareness around the global issues that diabetes has become, and to see that there is awareness that is created, there are activities that are undertaken to prevent diabetes. This year, we have IPL and Diwali competing, so we've had to move this earlier, and we are doing our conference today. So thank you all for joining in, and again, a very warm welcome to everybody. You know, I just want to start with a couple of a personal story. Just a few days ago, a friend of mine, a very good friend, was had to go on to dialysis. So she's on a kind of permanent dialysis now. And it was barely maybe a month ago or a month and a half ago that she was diagnosed as being pre-diabetic, not even diabetic. And look at the way she is, you know, things have progressed and she is where she is. So this problem is a very, very real problem, and one that touches every one of us. I'm sure everybody has similar stories to tell. And this is someone who has been health conscious all her life. So think about people who are poor, people who do not have the education, people who do not have the exposure to what good living is, to healthy eating, and all the rest of it. And we really understand how big this issue is and how it is hitting the productivity and the well-being of this nation. The vulnerable, especially if we look at this whole COVID situation, have become even more vulnerable. So there are the primary health centers are not working the way they used to. There is no one who's testing to see how anything other than COVID is happening. Medicines are not being supplied. So, if you look at, for example, the elderly in Bangalore slums, they've had absolutely no attention paid to them. And if they are diabetic, and we all know about comorbidities with COVID, we have the TV telling us that all the time. So add to that the anxiety that is building up, because every time you switch on the TV, someone is saying, if you're elderly, you're extremely vulnerable. If you're diabetic, you're even more vulnerable. So the amount of stress that these vulnerable sections of society are feeling is very, very high and extremely real. So then, which again brings us back to the collective belief that all of us have, which is that prevention is the only way. I want to tell you another little story. Again, during this whole COVID thing, another good friend fell sick. So she had, the cough and the cold and the fever and all the rest of it. And her level of anxiety was so high until she got back that COVID test and it said negative. So we were asking her, why do you feel this level of anxiety? Because you're not old, you are very healthy, all the rest of it. And she says, no, I have an elderly father with me, he's 90-ish, but that's not what makes me anxious. What really makes me anxious is my son. I said, your son, that guy is like in his 30s. She says, yes, because he's diabetic. So again, every one of these instances brings home the conviction for me personally that I'm doing something that is so critically important for all of us. So this, when we talk about the demographic dividend and all the rest of it, right? And we say India proudly proclaims that 2/3 of our population is below the age of 35. Is that really, if a dividend, if it is not a healthy population? And we are seeing with the example of my friend, for example, that, people below the age of 35 are getting affected more and more with lifestyle diseases, with diabetes. So for us, we have to take this up on a war footing. I would say that the issue is more than just urgent. It is absolutely critical that we deal with it now and deal with it on a really solid basis. Half of our population is under the age of 25. As they move into 35, we have to make sure that they do not get affected by this disease. We've all seen the forwards that come on our the photographs that come and the various forwards that come on our WhatsApp groups about COVID and the good things that have happened, less pollution, nature at its best. And that's wonderful. It's really been wonderful. People getting to spend time with their families. All of that is wonderful. But we've seen the bad side, right? We've really seen the bad of all of it. The key learning for us, though, is, and which is what is relevant to all of us and to our conference today, is that people have to stay fit, people have to stay healthy, not just physically, but also mentally and spiritually, because that's the only way to deal with an epidemic that comes our way and completely unexpected pandemic like this COVID thing, which none of us knew, probably except some very imaginative person in Hollywood. The rest of us had no clue that something like this was going to hit us. So again, prevention. That is the key to making sure that we are able to have a reasonable chance at a decent life going forward. The Arogya team has been very active through the COVID situation. After the initial few weeks of really not knowing what's happening like everybody else, they made the transition very nicely to digital. We've always believed in technology. Arogya has always believed that the way to reach out, because all of Arogya's programs are population scale programs, always believed that technology is key to making things happen well. But I think this situation has told us that it is the only way. The combination of the physical activities and the digital activities that go into making these prevention programs happen is absolutely critical. So, and the team has done a lovely job of building partnerships such as with the CII, and done some wonderful webinars, moved a lot of the content into digital format and so on. So I really want to place my appreciation for the team on record. I think they've done a fabulous job. I also want to appreciate the work that has been done by our healthy workplaces, because you have not stayed idle either. Every one of you has participated in these webinars and in these events and discussions, and have really shared very, very openly the kinds of things that you're doing, your practices, and what is important to the organization in a situation such as this. So, and we've also added 14 new healthy workplaces. My hearty congratulations to every one of you for having done this even in these really, really tough and demanding times. I want to talk about one other little example. You know, last year on World Diabetes Day, our Rotary Club, we went and did this diabetes screening at the bus stand. So we had bus employees, the KSRTC employees come there. We had passengers who were transiting through. They all came and had their vitals checked and had their sugar tested. Everyone who went back with a card that said not diabetic, you could see the smile on their face. And anyone who was diabetic, you could see their faces fall. But here was one. Two friends, I think both of them were bus conductors, probably came together. And the first one came, got his test done. He goes back with a bright smile because, he had his face fell because, he saw that his sugar levels were high. And then he was given this little booklet that said, here's how you need to kind of deal with this whole thing. Along with him was his friend, and his friend came, sat down, tested, all good. So he gets up with this bright smile, and the other guy claps him on the back and says, oh, now you can go back home and have those 2 laddus. Can you really do that? Is that what healthy living is about? Is that what diabetes is all about? Is that what prevention is about? Oh, no, not at all. So the job that we have in front of us, all of us as a collective, is to create that awareness that says healthy living, no matter what. It's not about saying, I've tested positive, or my sugar levels are high, therefore I need to be careful. If your sugar levels are not high, that's when you need to be doubly careful. And that's where you need to make sure that you don't fall into that category of person whose sugar is high. So, and we've also learned that it is not just the sugar levels, but much more the stress and the mental health and everything else. So I would like to invite everybody who's here and everyone who's listening in to please join hands. Let's all get together to make sure that the NCDs are prevented, because that is absolutely the only way. There is no way to treat ourselves out of this mess. We have to prevent, and prevent as much as we can possibly do in as quick a time as we can. So once again, thank you for being here. Welcome to today, and congratulations to everyone for the wonderful work you're doing. Thank you.
Thank you so much, Dr. Sushila. I think all the stories that you narrated were something that each one of us here can relate to. And having healthy lifestyle is a way of living and not something that we should, compromise on. Thank you so much for that. Coming next is the journey of Arogya World and its decade of progress. This address is by Dr. Nalini Saligram, the founder and CEO of Arogya World. A tireless advocate for NCD prevention, Dr. Nalini leverages public-private partnerships and global platforms to improve the world we live in. Nalini has lived and worked in many parts of the world, including Merck in Philadelphia, Glaxo Wellcome in London, and Hill and Knowlton in Hong Kong. She is also a member of the Global Center for Healthy Workplaces Advisory Board. Nalini is a frequent opinion writer, sought after speaker, and judge for global competitions on health. A major report was issued by Arogya World during the lockdown on the impact of working from home on workplaces in India. The report covers work done by Arogya World in April May 2020 and includes findings from a formal well-being survey adapted from the Institute for Employment Studies, IES UK. The report also highlights issues that were addressed in a series of webinars during the lockdown. Arogya World would like to thank our partners, Infra, GAC, CII, and CBRE for promoting the survey in workplaces in India. Now, over to you, Dr. Nalini.
Hi, my name is Nalini Saligram, and I'm the founder and CEO of Arogya World. We are a chronic disease prevention organization. We are committed to helping India meet its sustainable development goals and get its workforce to be healthy. I'm going to share a set of slides with you. So give me a minute, and welcome to our conference from my side as well. There we go. Okay. So NCDs are a big problem for 1 billion plus people in India. NCDs are non-communicable diseases like diabetes, heart disease, cancer, and chronic lung diseases. 80% of these deaths are in developing countries, so this is not a rich world problem. 20% of India has one NCD, 50% or more die from this. 75% of people in metros like Chennai are either diabetic or pre-diabetic, and the global economic loss from this is a staggering $47 trillion. And unhealthy eating is the #1 cause of deaths globally. So we tried to dive deeper into what are the causes, the systems that actually drive this big problem in India. And we came up with several: urbanization, modern lifestyle, big tobacco and big food, and their unhealthy or irresponsible marketing practices, health systems and the shortage of doctors and healthcare workers, and even employers are contributing to this problem. Employers have a particular responsibility to take care of the physical and mental health of their employees, and that is the subject of this conference today. Fortunately, there is a solution, and it's smart, and it's called prevention through healthy living. According to the World Health Organization, a healthy diet, exercise, and avoiding tobacco can help one prevent 80% of heart disease, 80% of type 2 diabetes, and 40% of cancers. So we don't need a new vaccine. We don't need a new technology. We just need to eat right and exercise and avoid tobacco. So this has now become, healthy living has now become more urgent and important in COVID times, because it is very clear that people with underlying heart disease or diabetes are actually at higher risk for more negative outcomes from COVID. So making our work even more important. We make prevention accessible. We take prevention to people where they live and learn and work. We call this the doorstep health model. And we have many programs. We have a healthy workplace program that we'll talk about a bit today, My Thali, healthy schools, and diabetes, and an app. And all of this has helped us reach and educate 5 million people to date on healthy living through our various programs. A bit more about the Healthy Workplace Program. It's 8 years old. The core of it is a formal application from a company that's interested, and a rigorous, direct, and robust and transparent in-person or online these days assessment, and then categorization of the company into bronze, silver, or gold qualitative levels. Then we have a quantitative level called platinum, where we analyze the employee health data trends from a number of companies and give them insights and reports. And last year, we launched a Hall of Fame that would celebrate true championship of employee health. And we offer additional programs that can help companies and their employees lead healthier lives. So you're all familiar with our conference. This is one set of pictures from a conference 2 years ago. And we share best practices. We recognize companies that have become healthy workplaces. We get leaders, and we together really advance the dialogue on workplace health in India. This year, 2020, is our 10th anniversary. It's a special year for Arogya. Even in the midst of COVID, we have found many reasons to celebrate. Many partners have joined us, not just on this program, but on all our programs. And for that, we are really grateful and thank you. We congratulate 14 companies that have stepped up even in the last few weeks and become healthy workplaces this year, bringing the total number of companies to 145. We, at the start of the lockdown and working from home, we did a series of webinars on workplace health and the impact of working from home on employees. And we did a formal survey as well. We're also doing a lot for mental health this year. We have new 2021 criteria that combine workplace, physical health and mental health that we're launching today. Please await a conversation between Usha Chandar and Dr. Shekhar Saxena from Librum. This is a COVID times request. This was number one request from companies all over India who asked us, tell me how I can improve the mental health of my employees. Tell me how to benchmark myself and give me clear guidelines. So that's what we've attempted to do. We have case studies of exemplary companies that have successfully deployed mental health programs across hundreds of thousands of employees. And we also have a very good set of stress reduction text messages that we have developed with NIMHANS. Our partners in workplace health include several really great organizations that have joined us this year. To each one of you, thank you very much. We cannot do this on our own. It's too big a problem. Thank you for your support and for joining us and working with us on advancing workplace health. So just to give you a glimpse into the kinds of criteria that we have, this is the set of the new mental health criteria combined with physical health. We developed them with Librum, with world-renowned mental health experts. So we had 4 physical health or NCD prevention criteria, and they stay. So tobacco policy, healthy eating, physical activity, and shifting mindsets. That's the same that has been there for 8 years now. And then we have new ones called mental health at work, which includes promoting well-being, managing stress, leadership, and supporting recovery. And then we also give some guidance on a few other things, including where to go for COVID. So learn more about this, but we're really excited. It's a first in India. I don't think these criteria exist, and we are very, very proud to have partnered with Librum to produce that set. So you'll learn more today. We also did this survey of the impact of working from home on the emotional and physical health of employees. And we worked with the Institute for Employment Studies to produce this, to take their survey and to produce this report. Overall, it's very clear to us that the strategic value for workplace health has increased greatly, tremendously in COVID times. It's now a boardroom issue. Companies must communicate more and continue to do that and engage with employees and give them meaningful work. Mental health is a #1 concern. And now more than ever, it is crystal clear to me that it is important to lead a healthy lifestyle. We must boost immunity by eating right. We must lead a balanced life and go for a walk and prevent disease. This is at the core of all of Arogya's work. Just to give you a little glimpse into the kinds of data, so we were able to get things like, 60, 70% of working Indians told us that they felt cheerful or in good spirits. They have felt active and vigorous. They feel calm and relaxed. They get up feeling refreshed, fresh and rested, and their daily life is filled with things that interest them. So this is a very good indicator of resilience, and we're really grateful that companies, as 87% of the employees acknowledge their line managers are reaching out to them. 84% said they were valued by their companies, and a whopping 89% of working people said they were motivated to give their employer 100%. Hey, can't ask for anything more. And that shows us that maybe because of the social cohesion and the family ties and the way the managers are reaching out to employees, even during lockdown, resilience stayed high, employee resilience stayed high. Still, we are concerned because we know that people are worried about their family finances and about job security and so on. So mental health remains and has become a major problem for all of the working population. We have a number of tools. One of them is called My Thali that we're offering to our healthy workplaces. This is a picture of a thali that shows exactly what somebody should eat and in what quantities. It shows cooked food. So it's very easy to follow. We're rolling this out along with talks and cafeteria menu audits and chef demos and email campaigns and communication materials to companies. And so please avail of this. We really, really believe this is an excellent tool to change the way working Indians eat. We also have a terrific lifestyle coach training program that we're bringing to you directly from the CDC and Emory University for the first time to corporate India. Our coach has been trained in Emory, at Emory, and Anand Vallavi will take your people and train them how to become online in an online session, how to become coaches. Then they can go and take your high-risk employees through 16 weeks of one-on-one sessions that can help them, not one-on-one, small group sessions that can help them change their lifestyle habits. This is proven to work. It's a really great way to help your employees prevent diabetes in large measure. We also have great communications materials. Please use them. It can help you with employee engagement. Our Platinum program is showing great promise. We have 33 companies that through last year were recognized by us as Platinum, and they're showing really terrific data trends. And as I said, we have this Hall of Fame that champions celebrates champions of workplace health. And we didn't have anybody this year, but we will relaunch it next year, and it's because of COVID. We're very proud of Hero MotoCorp that became last year the healthiest workplace in the world. They were recognized by our partner, Global Center for Healthy Workplaces. What is interesting is the trajectory of this company. It was a 2017 healthy workplace and then graduated to a platinum healthy workplace the following year. And then the next year, it became the #1 healthy workplace in the world. So congratulations again to Hero MotoCorp. So where are we headed when India will be 75 years old? That is at the end of 2022. We want to have educated 22 million people on healthy living. And a good portion of that is going to be from the Healthy Workplace program. So we continue to seek your support. The other thing we want to do is bring down costs. So in our first decade, our cost has been 60 cents a person, this is in US dollars, and we want to bring that down to less than, to about 25% of that in the next couple of years. So how do we expand reach and how do we bring down costs? We want to do that by working with technology, by leveraging it, by working with government and building strong partnerships and continuing to find passionate people to work with us. So just a word on the technology. Technology will help us scale by helping us identify and engage with hundreds of companies over a number of years. Our engagement is not just a one-time transaction. It's continuous engagement back and forth on so many aspects of employee health. We want to do online audit and assessment. We want to establish a data-driven culture of health. We want to produce HR dashboards that give HR managers a quick finger on the pulse of employee health and health behaviors. We want to deploy our 16-week lifestyle change program and our Maithali among millions of employees. We wanted to be a repository of so many questionnaires and best practices and case studies, etc. And we also want to work with partners and run, for instance, a major global workplace health summit. So all of that is possible to some extent with technology, and we are really committed to deploying that. I want to take this opportunity to recognize and thank an exemplary healthy workplace team led by Usha Chandar. It also has Dr. Geeta Bharadwaj, Ashwini Thakkar, Nandan Bhatia, Vijayalakshmi Harish, Kshema Kurup, Sumati Rao, our country head, and our tech lead Raghu, who have all worked really hard to make this program and this conference a success. And we can call upon so many wonderful people who are our workplace health advisors. So thank you thank you to all of them as well. Every year, this conference brings to us some really positive comments, and we hope that this journey with Arogya World and this conference itself will really help you think through and wrestle with some of the workplace health issues you are finding challenging, and we want to continue to help you on your own health journey and your company's health journey. So enjoy the conference, and Soumya, over to you. Thank you so much, everyone.
Thank you, Dr. Nalini, for taking us through the amazing journey of Arogya World. It's really awe-inspiring to see the kind of progress this small team has managed to achieve under your inspiring leadership. Now, let us present to you in our inaugural address, Mr. Krish Shankar, Group Head HR Infosys, who will share his valuable insights in the inaugural address on leadership and employee health and well-being in the new normal. Krish Shankar has over 30 years of experience in this space and has been instrumental in leading the transformation of HR into a strategic partner. He is also the current president of the NHRD Network, a pan-India body of HR professionals. Krish is passionate about exploring and sharing new ideas in HR and organizational development. A football enthusiast, he also likes trekking and running. Over to you, Krish.
Good morning, everybody. It's a pleasure to be here, and thank you all for joining in this very important session. I think we've all been talking of healthy workplaces, wellness for a long time, but I think it's come to really it's become more important now, and it's really touching everybody a lot more deeply over the last 6-8 months. And I think this pandemic has really taught us that this is something that we should not really take for granted, and there are many things that all of us need to really work on. So what I'll do now is really take the first couple of minutes, talk about some of the things that we've all seen. I mean, nothing new, but some of the things that we've all seen in terms of health, and maybe think about how, as organizations, we need to really rethink or reimagine how we look at wellness. Yeah, and maybe I'll share one or two things that we are doing at Infosys. It's still a journey. I don't think by any means anybody's cracked everything, but it's just something that I thought I would just share with you. Yeah. So if you go to the next slide, this just really talks about the impact of COVID. I mean, while there is general health or general kind of wellness all across, what we've now seen is the impact of COVID, and it has got various impacts, right? The first one is really, the immediate one of people falling sick, going to hospitals and all of that. And I think all the attention that we need to give to people who have extra kind of comorbidities, as I say. So that's really one big part of it. That's sometimes the very urgent that you got to do. But there's also other things. For example, if you really look at the kind of the second wave, which is basically, in terms of, as somebody mentioned, because of COVID, there are many other illnesses that have not really found, focus. People have not, and they may really come up. So that you'd see, people, dormant illnesses, dormant things that people have either been afraid to go to a hospital or hospital has not given resources. They could be the second kind of the thing. And similarly with people who've got chronic conditions, dialysis and various other things, they also go through various challenges. But the fourth wave is the one that is a bit unseen, and it's all to do with various habits that all of us have. And let me just give you a quick example in a way. When COVID started and we started working from home, like in the middle of April, suddenly I like bent down to pick my shoes and had a kind of a back pain or a spasm, and I was down for almost about 2 weeks. And then I thought, my God, maybe it's just because my chair is not right. So I changed my chair and got a better one, etc., etc. But again, it's 3, 4, 5, 4 months down the road. Again, about a few weeks back, again I had another kind of a thing. So it's like, and I've not had these for many many years, and sometimes and these are things that really come up. That's one. The other part is really mental health, and there are lots of people who either they're alone, there are other stresses that they are there. We don't see it, and that's something that could really build up. Because I think one of the things that office does is really get people. You can share some of your issues, and there's always a very supportive group. While you do that online, but maybe it's not really there. The third thing is there could be other habits that you all develop, maybe wrong dietary habits, and maybe sometimes your sleep habits go wrong, and all of those are also issues that may really kind of play out in the longer run. On top of that, I think this whole balance between work and work from home and various things. And for many people, you got to balance things at home. You got to balance children, education, schools, all of that. While you still have to do all your work and your calls, it's not going to be easy. And I think that pressure really, and with not enough support, sometimes it becomes much more challenging. And that will definitely have its toll. So you see that while the health at the workplace was always an area that we were looking at, now we've got many more things. And I think this COVID is really bringing to us what it is. And I think it's important for us to really understand this and kind of work on it. What I'll do is, if in the next slide, I'll really talk about some broad areas. I mean, these are, if you look at any organization, I think all of us have to really look at these 5 R's in a way. Yeah, and these 5 R's really basically it's about there is something that you got to do in the short term. Whatever is needed, either tie-ups with hospitals and whatever, and various other things. In the short term, you manage the employee's health, which involves wherever providing health support, but also lots of communication, lots of fitness kind of programs, etc. The second thing we got to do also is start building this resilience, which is all about this emotional and social kind of support. And that's sometimes very, very important, and maybe small things. And I think how we start talking about small initiatives, either it's about, being positive or celebrating gratitude or, getting connections together. So that's really very important. And sometimes that's not really at the top of our agenda, but I think we've got to now start thinking about it. The third area that we all have to do is return. Sometime in May and June, we said we're going to get people return. We're planning that first week we'll have 10%, then after 2 weeks it'll be 15%. So we really planned a kind of a thing. But nothing happened because some people came, and I think there were 1 or 2 issues here and there. And we now, if you look at Infosys, we are roughly at around 1 to 2% working from offices and 98% working from home. And the story is the same with all tech companies. And thankfully, that the tech industry is, at least able to work from home. And you just imagine the challenges that many other industries have. So, but having said that, over time, someday we'll have to come together. Someday we'll need, and even for the sake of getting the teams together, you'll have to have something coming. And therefore, how do you plan it and what kind of things? So that's something that we need to really look at. But then there are two other longer term things, and these two which we've got to think is really rethink our whole thought about what is wellness, what is well-being, and how do you really look at it. And while we've done a lot of this physical health and diet in the past, I think a lot more about the social, emotional stuff needs to be really picked up for us. But also things like, what does it mean for vaccination? What does it mean for travel? What are some of the things that you need to do when people are working from home? And therefore, where is your responsibility? And as an organization, what kind of support can you provide? So I think it really expands a lot more as you rethink this whole idea of wellness. And the last is, I think, are there some reforms that are needed? No reforms in laws or what to do with insurance. So therefore, that's something we need to think of. So I just thought these 5 R's are important for all of us to think about. The first three at the top are immediate, in the let's say in the now and the 6 months, but the last two are a little bit more longer term. Yeah, and I think just to give you an idea, maybe all of us are doing it in some way or the other, but I just thought I'll place that in context. Now let me now go and talk about some of the things that we do in Infosys. Yeah, in just a few minutes on that. I think in Infosys, we had something called HAIL, which we started a long time back, which is all what we call as this health assessment and lifestyle enrichment. And we had, these four, if you look at physical wellness, emotional, social, and safety. And safety, social, and emotional has taken a lot more focus now. And I'll talk a little bit about what we are doing. I think 2 or 3 things that we have done and we've looked at. How do we move to digital? And we've tied up with many of our health providers in terms of telemedicine and various other digital support. We've changed the policies in a way so that people can really look at both health, but also look after their ergonomics and other things. But the most important is really, drive a lot more of self-service for employees in terms of, telling them about what are some of the things that they need to do. And that has been very, very critical, because giving them all kinds of information and tie-ups where they can reach out and do things has been very important. If you look at it, managers and teams are critical. How do you really get them at the heart of your wellness kind of strategy is important, so that they can really come together and help you drive things. Yeah, so that's another thing that we've got to do. So I think our changes with technology coming in, with this focus, I think the changes are we can be a lot more personal in the way we reach out to people. Yeah, and I think we've got to do through various ways. Build lots more communities on various things, like communities which says we are a community which only talk of mindfulness. We are a community which are talking about yoga. We are a community which are talking about ergonomics at work. And there are lots of things that people want to share and do, and therefore we can really build around them. So I think we now have to move saying, how can we reach a lot more to our people through a digital medium? Yeah, and therefore some of these are areas that we've got to work on. I'll just go to the next slide and talk a little bit about what we actually did and some of the things that we had in the last quarter. And you can see a lot of offerings. I mean, our employee relation teams and the people looking after wellness have been extra kind of busy, and various things. I mean, I think things that you would have and many other companies would have done in terms of various campaigns really to get key things going together. In terms of fitness schedules, or in terms of what can we do for the family, in terms of tips for the family, and things like we also started. We have something called Samaritans, which is like an employee self-help employee support group, and mainly first level counseling by employees themselves. We developed something called Women Samaritans, so women only for supporting women, because we realized women was a group which is really much more at the receiving end of many issues there, and therefore that is something that we started. We also really created this whole nudge towards more balanced living. So we call this Infi Ikigai, which is all about giving employees nudges to say, listen, take some time off, take leave, don't go do calls after 6:30. Have some, like each department can take half a day where they don't have meetings or calls, etc. So idea is to really start doing some things and create the awareness. There's no one answer to it, but I think this is all about series of things we can do to really start creating awareness. And that's what I think we've got to start doing it. I think there are many things that came out. For example, domestic violence at home. If that's an issue, how do we really talk about it? And how can we increase some awareness about it? Of course, what kind of safety at home. There's lots around, lots of information available, but we also thought we'll do that. I think when you really look at this whole well-being, I think three things really stand out. One is, I think there's a need for alliances, need for partners who can really make things do. Because there's so many things, and there'll be great people who are really there. So I think that's something we've got to build an ecosystem that will help provide all that support. The second is digital. Yeah, what you can do, because you can reach much more personal. People can reach at different times, and therefore use the digital a lot more through communities. That's the other thing that we've been doing. And the last is enabling them, especially the managers, because they are the core of all of this. So I just thought I'll give you a quick idea of some of the things that we're doing. I know it's like a journey in progress, but at the time that we keep getting feedback from employees, and we feel that employees rated high in terms of the kind of support they've got on health and wellness was kind of satisfying over the last 6 months. And let me kind of take to the last chart here. Really to talk about the 3 or 4 areas that all of us have to really kind of work on. Yeah. Uh, how can you become more digital? What are the things that we can do? And I think, and this whole idea of personalization becomes very important. And how can we really do that? I spoke to you about these communities and alliances, yeah, because I think that's another very important thing. While we've been doing a lot, I think that's an area that all of us can really start doing and expanding that. Definitely getting your teams and manage, because if the managers and teams take ownership for health, then they'll do a lot of things themselves. Yeah, so you got to get them to take this ownership, build that kind of empower them to take ownership of their own fitness, own health, etc., and they'll do a great job. So therefore, that's the other thing. So I think these are all the things that we've got to do. I thought I'll give you a quick kind of a thing. But firstly, it's a journey, and nothing is going to happen in a day. I think this is as I say, the time is ripe, because now the kind of the iron is hot. Now it's time to really create, because people are much more aware, and it's time for us to really increase this awareness, build the ecosystem, and start really ensuring that the gains that we've got, the gains in a way, the focus on health and awareness in the last 8 months continue, and we create new habits in people, and that's important. Sometimes these habits are not easy to do, and if I end with this small Dilbert cartoon, which really talks about, to the next slide, please, yeah, which really talks about the last bit, in the sense that while we do all of this, there'll always be, you can say, yes, I'm doing a lot of wellness, but there'll always be something that is there. It's good, as long as there is a bit of celebration, you can still have that cake, but try and increase that awareness. So with that, I think I just thought give you my perspective, give you some of the changes that are happening, and I'm sure with this conference you spend the day the really understanding and picking up some ideas, and seeing how as a community all of us can come together and really increase our focus on health and the awareness on health for everybody. Thank you very much.
Thank you so much, Krish, for sharing those critical insights on how it's been working at Infosys. And it was very inspiring to listen to every component of well-being campaigns, fitness schedules, how the family is part of the ecosystem, the nudges, and of course, how good Samaritans are out there to solve this, and how it's going to be a habit for future for us to invest in. Thank you so much. And again, the kind of protocols and how they help employees work from home, and what's the plan when you return back. So thank you so much, Krish, for that. Now, going forward, an important milestone in the journey of Arogya World's Healthy Workplace program is the launch of the Arogya World's mental health criteria for workplace. Mental health is being increasingly recognized all over the world as the biggest fallout from COVID. This is true in India as well. Arogya World has recognized the rising need to address the mental health concerns of HR leaders and provide guidelines that could help them in supporting mental well being of their employees. In this regard, a set of mental health criteria has been developed by Arogya World in partnership with Librum principals, Harvard professors Shekhar Saxena and Vikram Patel. With a great sense of responsibility, we launch these, a first in India at this conference. We hope our criteria and the support we offer will inspire companies in India to do more towards mental health. As the mental health criteria is being launched, welcome to this interesting and thought-provoking fireside chat between Usha Chandar, head of Arogya World Healthy Workplace Program, and Professor Shekhar Saxena of Harvard University. Usha joined Arogya World 5 years ago and is deeply involved with the evaluation, assessment, and metrics for Arogya's flagship Platinum program. She has worked as a consultant in quality assurance in higher education at universities in South Asia and Southeast Asia. She has also been an assessor of BBA and MBA programs under the World Bank funded project in Bangladesh. Introducing Dr. Shekhar Saxena, he is a professor of the practice of global mental health at the Department of Global Health and Population at the Harvard T.H. Chan School of Public Health. A psychiatrist by training, he was the faculty of AIMS, New Delhi, before he joined WHO in 1998. His expertise includes providing evidence based advice and technical assistance to policymakers, businesses, and civil society on mental health promotion, prevention, and management, neurological substance use disorders, and suicide prevention. Now, over to you, Usha and Dr. Shekhar Saxena.
Good morning, everyone. Thanks for assembling here, and especially Dr. Saxena, which is for him, it is very, very early in Geneva. We are forever indebted to you, sir, for this session of yours. Mental health problems affect many employees, a fact that's usually overlooked because these disorders tend to be hidden at work. Research shows that a significant percentage of employees experience symptoms of mental health disorder at some point in their career. But the stigma attached to having such a disorder deters an employee from seeking treatment, in many cases out of fear that might be labeled and that he might be labeled, and he or she rather, and might jeopardize their jobs. Managers want to help, but in most cases are unsure about how to provide the right kind of support. As a result, mental health disorders often go unrecognized and untreated, not only damaging an individual's health and career, but also reducing productivity at work. We believe that adequate treatment or therapy, on the other hand, can alleviate symptoms for employees and improve job performance. Now, if you look at a bit about the statistics in India, there are 1.75 million workplaces, out of which 80% are registered as workplaces. And in that, only about 5%, a few thousands of people have a structured EAP program, and very few have a comprehensive approach to mental health issues and having a good mental health program. So it's definitely part of the overall health and well-being, right? And all of us would agree that it affects how we think, how we feel, act, how we relate to others, so how we make choices during emergency times and so on. And definitely people with pre-existing conditions may be particularly vulnerable. So I believe it's very essential to know, first of all, what is mental health, what constitutes a mentally healthy company, and let's begin with a brief description. Professor Saxena, I would like you to please start with a brief description of what is mental health and why is it important to all of us, and what would make a workplace mentally healthy. Sir.
Thank you very much, Usha. It's such a pleasure to join. And to begin with, I would like to congratulate Arogya World in paying so much attention to mental health now. Mental health is an integral part of health. So actually, if Arogya World is dealing with health, there is absolutely no reason why mental health should be excluded. So that's an integral part of not only health, but our whole life. Let's go back to the WHO's definition of health, which talks about the physical, mental, and as well as social well-being. And if we have to cover health, if we have to really think about our own health, we just cannot ignore the mental and the social well-being. And I was very happy to note that all the earlier speakers, including Dr. Sushila, Nalini, as well as Krish, talked about the psychological and the social aspects of our life at the workplace also, which are extremely important. As we say, there is no health without mental health, and we need to really put that into practice rather than just to be aware of it. These times are also very important because these times have brought out the importance of psychological and emotional health right in the center of our living and our working. We define anxiety as a reaction to uncertainties, and at this time we are living in such an uncertain environment. We don't even know what's going to happen tomorrow. We don't know what will be our health status tomorrow. If we might get infection, if somebody in the family might become positive with COVID, and what's going to happen to our job, our income, our social well-being. So these are times where anxiety is almost a textbook picture, absolutely a perfect storm for anxiety. But also, let's not forget depression, which is a reaction to losses. And we're having plenty of losses. We sometimes are losing some of our people in our family or colleagues to COVID, so many deaths. Also illnesses, people getting admitted, people suffering because of COVID as well as the accompanying condition, and losses related to our income, sometimes our jobs. And those are all causes for depression. So it's a time for anxiety, it's a time for depression, and this is becoming obviously a very important thing to do. I'd just like to add one more thing. You talked about mental illnesses, but I'll really like to focus on mental health, which is important for all of us. The simple fact is that mental health is a spectrum, starting from some people who will have very good mental health to some people who have some difficulty in coping now, people who might have a mental disorder like anxiety or depression, sometimes alcohol issues, and people who will have a disability because of their mental functioning. Now, during times like these, which we are living through, all of us move towards the right on this spectrum. If we were able to cope well, we're finding it difficult. If we had some symptoms of mild anxiety and depression, we are going into a disorder. If we already had a disorder, and disorders are very common, we are going into more disability. And so this shift to the right on the spectrum of mental health and well-being is something that we need to be prepared for. And obviously, it was already pointed out that prevention is better than treatment. So we really need to look after our mental health, protect it, promote it, so we don't actually need the treatment which will be there for the mental disorder. So I would like to highlight the importance of this spectrum and for all of us to do whatever we can do for our own mental health.
Thank you, Professor. You're so right. There's no health without mental health. And in these pandemic situation, it's very sad, but morbidity, mortality, words like this have become so common. So moving ahead, sir, impact of all that you spoke about, anxiety, fear, a lot of stress at workplace. Definitely, this is very significant for business, right? Now, productivity, of course, we all know it's a no-brainer, is negatively impacted under circumstances, and there is a strong connection between mentally healthy workplace and achievement of business objectives. So with your concept, the concept that you have just now come up with, on mental health, what do you think will be the impact mental health will have on business? And now in COVID times, it is said to be one of the major faults, as you rightly pointed out. So can you paint us a picture of what you see from your perspective, sir?
Thank you, Usha. Mental health is extremely important, as I said earlier, for all of us, but also important for companies and businesses and industry in general. We don't really have our life totally segregated into our work and personal and social environment. We bring our person, our family, our psychological issues to work, and also take back the work-related stresses back home. It's like we are cautious about not infecting others in the family. We also should be aware about not bringing the stresses to the family and ourselves in our work life. In fact, nowadays, with 98% people working from home, these are merging quite quite closely, and all of that is having an impact on the businesses and the companies. We spend a large amount of our time, our waking time, on in work or on work, and that is really one of the most important aspects of our mental health. But businesses get affected in a variety of ways. I will divide all of that into two compartments. One is what's the effect on the health and wellness of the employees, which obviously includes managers and the owners and the higher management. And all of us are in the same boat. So they all get affected. Even the most employee who's at the lowest level to the employee who at the highest level, we all are human beings. So we all get affected by that. And our health and wellness is extremely important. But that's not the whole story. There is also the economics of it. A lot of businesses are actually losing a lot of money in terms of their profits because of mental health problems. There's the absenteeism, people not coming to work or not working because of mental health problems, and also presenteeism, which is when people are actually working but not to their highest capacity. So both of them affect the revenues, the profits in very substantial ways. And these are not inconsequential. They really affect the bottom line in a very large way. It's literally billions of dollars worth all over the world, and the situation in India is not very different. So you are actually losing money because you're not paying attention to the mental health and well-being of your employees and not making them flourish. It's not only important to survive, it's important to flourish. That's where human beings do the best and the companies do the best. So these are aspects which were important at all points of time, forever, but they are extremely important even now. In fact, more so now, because we are running through times which are extremely difficult for all of us and for companies. So we need to really see to it that we pay more attention to the mental health and well-being of all of us at workplace, and also do the things that are necessary for the whole range of problems. It's not just important to identify those few people who have a disorder. It's important to really work on the protection and promotion of mental health and well-being for all of us. And that's what good companies, that's what progressive companies are doing now. And that's what we really need to encourage people to do, so that we decrease the burden, but also improve the functioning, which is equally important.
Thank you, Professor. Just to substantiate the invaluable thought that you have shared with all of us, with a bit of statistics. So the World Health Organization estimates that India will suffer economic losses amounting to a staggering $1.03 trillion from mental health conditions between 2012 and 2030. And the post-pandemic world and shifting workplace dynamics and work from home, job uncertainty, they've just worsened the situation. So I tend to agree with you that definitely all the corporates have to look into this and then get their acts together around mental health or mental well-being. So when we conducted, Sushila mentioned about the webinars that we conducted, Professor, during the lockdown. So while we were doing that, this kept coming up, the need for some sort of a framework that can be implemented at workplace. So the HR fraternity was constantly, sending us signals that it may be helpful to come up with some sort of a framework that can provide some guidelines for these corporates, especially those who are looking at creating something new in the organization under the situation. So we that's why we came up with this healthy workplace criteria, which Nalini also, spoke about in her opening remarks. And I would like you to please tell us, have you seen the criteria that we have right now, which combines the physical health as well as the mental health at workplace? Have you seen this kind of criteria outlined in workplaces anywhere in the world?
Usha, we were very happy when Arogya World invited us in Libram to develop these criteria for mental health at the workplace, because I've been working in the mental health area for the last 40 years. And I haven't seen any organization which has developed the criteria in such a systematic manner. If there were one, we would have just imported it, but that was not the case that we worked on. Me and my colleagues, Vikram Patel, as well as Sonali, one of our younger colleagues, worked on these and investigated and searched for all the literature that we could find on this issue, including case studies and in case of many other countries, how they were using some of these material. Yes, there is a lot of discussion, but we could not find a set of criteria which we could actually start using for Indian businesses. So we actually got down and developed some, of course, based on the evidence and information that we could find globally. So I would say that these set of criteria that we have developed for Arogya World are one of its kind for the first time anywhere in the world. And we really hope that Arogya World member companies are able to understand, to apply, and to start using them, because this is extremely important for their employees' mental health, and eventually, as I was explaining earlier, for the growth of the company, for how the company is dealing with the issues that are coming up so much. So we are really very proud and really privileged to be able to develop these criteria and along with the accompanying material. And we would really like the companies to start getting familiar and start using them. And obviously, it's a trial period, so there will be some issues that will come up, but we're very happy to assist companies in starting to understand and use them. Let me just add one more issue to that. As Krish was saying earlier, it's not that we are going to make a difference in a day. It's going to be a process. So once we start, we will realize what are the important things that we need to assess and to do. And slowly but gradually, we will reach there, so that we put mental health totally at par with the health of our people, and give it the importance that it deserves, so that we really become much more conscious and much more active about using it. And I'm very happy that Arogya World is putting the mental health criteria together with health, because we really want to integrate it together and not keep it as a kind of separate thing which you could do or may not do. It is something which is essentially a part of health. So it should be integrated, and that's what we would like to see.
Thank you, Professor. So, in the interest of time, just two very quick questions for you. One is, of course, taking up with the criteria. So definitely we believe that this will be a stepping stone for all the organizations to come up with a robust mental health program. So I would like you to please quickly tell us about what kind of responsibility the top leadership can show. And also, what is your vision on the mental health at workplace, how mental health at workplace should be in India, let's say in about 5 years' time? So
Thank you, Usha. I think the leadership can and must play a very important role in mental health and well-being of the entire company and its employees. If you don't start at the top, either nothing will happen or something will happen which will not really respond to the urgent and the important needs that are there at this point and in future. So leadership must understand, must take interest, and must guide the whole company into this kind of practice of taking mental health and well-being in its entirety and for all the people. It should promote well-being. It should prevent illnesses, and if some people have an illness, it should start a discussion without stigma, without discrimination, and make sure that mental health needs are fulfilled in the most evidence-based and in the most open way. We need to start a dialogue. We need to start a conversation which normalizes the mental health. It should not be something that we talk about in whispers in a room. We should be able to talk about it in a town hall meeting, and people should be able to discuss their own issues which they might have felt in their work life or in their personal life. As I was very happy to note, some of the people talked about it earlier in these sessions, so that it becomes something that is okay to talk about, okay to take action on. So that's what we hope. And our criteria include the leadership, promoting well-being, managing stress, and supporting recovery. All the things that are important for the dimensions that I talked about earlier on mental health. To touch upon the last question that you asked, what do I see happening in the next 5 years? I would say something should happen now, tomorrow, and in 1 year, in 2 year, in 5 year. But in 5 years, I would expect all businesses, all companies in India, whether they're small, medium, or large size companies, to really take on board some of these criteria and some of these actions to really start taking the importance mental health has in their own functioning, in their own life, and provide the kind of environment that we need. There will be needs. It's not that once the COVID is over, the needs are over. This should have been done even 10 years back. It's good to start now, but in the next 5 years, if we can pay attention, do things that are necessary, and take us towards an organization that is mentally healthy, that will be something that we all can be very proud of.
Thank you very much, Professor Saxena, for these enlightening thoughts that you've shared. And in fact, it's been a learning for me too. I've taken a lot of pointers from this discussion, which I believe will get us a great buy-in when we go and talk about the necessity of having a program like this at the workplace. Thank you so much. Over
Thank
to
you, Usha.
Soumya.
Thank you, Arogya World, for developing this very useful tool for corporate HR leaders, which will surely help them as they address mental well-being of their employees. Thank you, Usha and Professor Saxena, for this delightful fireside chat. Okay, so while we have had an engaging conversation with a lot of speakers since this morning, we would also like to bring in our audience in. So we will have a poll that will flash on the screen, and with some questions and responses that we would want you to participate in. So I'll just read out the question, and while it flashes on the screen, you could respond which option do you think sounds great for the question that we have asked. So here's the poll question: which lifestyle habit causes most deaths across the globe? Your option 1A is unhealthy eating, B is physical inactivity, C is tobacco smoking, and D is lack of sleep. So, go ahead and check your option. There is 15 seconds when it'll stay on the screen for you to respond to this. We're going to have such polls intermittently to get a sense of what's on people's mind, and this is the best way to kind of understand how are people thinking about mental illness, looking at the way forward. And of course, as we have already heard in the conversations in the past this morning, as well as the time to come, it's been a disruption of sorts, right? People are becoming creative because they have to tackle the pandemic, and a lot of innovation is happening. So let's see what's in offer for us. And I think the poll is ending. So while we continue in our journey and bring you the panel discussion of employee well-being strategy learnings from COVID-19 now. India is a young country, and most of the workforce spend a lot of time at work, clocking roughly about, I think each one of us clock about 40 hours at work. And it will benefit all of us if leaders take proactive approach towards workplace health and well-being, establishing a culture that encourages and promotes positive well-being, thereby making an organization really attractive for the next generation to come. A genuine well-being strategy will only work when the president is set from top to down. It has to be part of the organizational culture. I believe that building an organization's overall well-being strategy is as important as building a brand and developing products and services that we are part of, right? So this panel now will be moderated by Sujata Kelkar Shetty. Dr. Sujata Kelkar Shetty is a biological scientist trained in US. She did her postdoctoral training and has worked on pathways of stress-related immunosuppressions. Sujata has been focusing on research and writing with regard to wellness for the last decade. Her writing is unique in its emphasis on cutting-edge medical research and age-old Ayurvedic practices. She is also a certified coach, conducts wellness workshops, and a trained classical singer. She has a bachelor's degree in genetics from University of Wisconsin-Madison and a PhD in toxicology from the University of Kentucky, Lexington. Now I pass on the baton to Dr. Sujata. Over to you.
Thank you. It's a pleasure to be here today. Thank you, Arogya World, for inviting me to moderate a very illustrious panel that we have today. Usha and Dr. Saxena have shared some valuable insights on mental health in the workplace and mental health in general. And this becomes particularly relevant today because of this extraordinary time that we live in with the pandemic. I'm going to keep my my sort of introduction for the topic of today very brief. But before I do that, I want to share with you the panelists that we have, share their background with you because they're a very illustrious group. Now, R. Anandakrishnan has been associated with TVS Motor Company since June 2005 and leads the company's HR and IT practice. As an integral part of various companies within the TVS group, Anandakrishnan brings with him over 32 years of industry experience in manufacturing, sales, marketing, business planning, human resource, and information technology in varied business environments in India and the overseas markets. His areas of specialization and interest include business HR strategy, change management, leadership development, organization restructuring and design, and compensation and benefits. He currently co-chairs the Human Capital Group of ISA. We also have with us today Mr. Himal Tiwari, who is the Chief Human Resources Officer of Tata Power Group. He has over 22 years of diverse experience across large conglomerates, as well as global consulting organizations, and brings with him a wealth of expertise spanning across various HR domains. Mr. Tiwari has a rich experience across multiple industries and has been working with various leadership teams in organization effectiveness, leadership, and change. He started his career with leadership consulting and executive search and went on to lead various facets of HR, including leadership acquisition and assessment, board effectiveness, and HR research. We also have with us Alok Ranjan, who is an XLRI alumnus and has played a significant role in talent retention, development, performance planning, and training across renowned organizations, namely ICICI, KEC, and the Times Group. As an effective HR leader, he has brought focus in maintaining the company culture and communicating to employees the importance of working towards attaining company goals. And last but certainly not the least, we've got Dr. Kranti, who is a postgraduate in obstetrics and gynecology and holds a diploma in public health. He has been in the teaching profession and clinical practice in government and private hospitals. He's now in the development sector for over 15 years and has worked in various international and national development organizations like UNICEF, PATH, FPAI, Family Planning Association of India, Aga Khan Development Network, etc. He currently works at Cipla Foundation, responsible for the health vertical and supporting clinical services at Cipla's Palliative Care Center in Pune. He has experience in designing, implementing, training, monitoring, and evaluation of various projects in maternal and child health and in non-communicable diseases. Dr. Kranti, my work at the NIH was in the National Institute of Child Health and Human Disease, so I feel particularly connected to you right now. He's also associated with various NGOs working with rural and tribal health. Now, we got a beautiful introduction from Dr. Saxena and Usha, and the one thing I would like to remind all of us, we know this intrinsically, is that work is good for mental health. Right? It's an important piece of our mental health. But the question is, how do we strengthen it? How do we make ourselves more resilient, particularly in times like these? Now, we all know this, but just to bring this home, depression and anxiety have a significant economic impact. The estimated cost to the global economy is over $1 trillion in loss of productivity. And this is because they say that the estimate is that 264 million people suffer from depression and anxiety. And it's one of the leading causes of disability because many of the people who suffer from depression also suffer from anxiety. Now, there are many effective solutions that organizations already have in place and can put in place to promote mental health in the workplace. And research according to the WHO shows that for every $1 put into scaled up treatment for common mental disorders, there's a return of $4 in improved health and productivity. Now, the Center for Disease Control and Prevention, which has currently got a bad name thanks to you-know-who, but is a very illustrious organization, cites that work-related stress is one of the leading workplace health problems and a significant occupational health risk, one that outranks physical inactivity and obesity. So the stress is a risk factor for just about every a non-communicable disease known to mankind, and also to communicable diseases as well, because it lowers our immunity. In addition to supporting employees' physical and mental health, well-being programs can help tackle employee burnout, stress, turnover, and absenteeism. Now, there's plenty of research to show us that we need to tend to all the pillars of wellness, our physical, mental, social, and emotional well-being to function at our best. Across the world, and India is no different, mental and emotional well-being often gets brushed under the carpet. This is both by individuals and in organizations, right? And mental and emotional well-being concerns are definitely on the rise, given the scenario that we live in. And since wellness is like a wheel, right, where if one aspect suffers, the others do too, what we've got then is a situation where people's general health is at risk. And by general health, I'm talking about lifestyle illnesses, which are already on the rise in India, and they're on the rise in India at a lower sort of age and stage, right? We tend to get our lifestyle illnesses 5 to 10 years earlier than the rest of the world. So this is really a cause for serious concern, and I'm going to go right into the questions that I'd like to ask our panelists. So the first one is, I'm addressing it to Mr. Anandakrishnan, and that is, why do we need to focus on employee wellness, particularly mental wellness right
now? Thank you, Dr. Sujata. It's been a great session throughout since morning. So let me start off from TVS Motor. So many of you know that we are in the business of making motorcycles and making people move from one place to the other. But unfortunately, the auto industry is not known to be working from home. And this is something that is an extremely new stuff for us over the last 8 months or so. Uh, but at TVS Motor, we are always an organization that have emphasized on key values, which include respect for people and being customer focused. It's based on these values that today we are known as a people first approach company towards customers, employees, and stakeholders. So far, we have always worked on a healthy mind in a healthy body kind of a concept where we have a fully functional occupational health center which regularly conducts health checks for people. So physical physical health has been given a lot of focus in our group of companies, and we are also been a proud recipient of award for healthy workplace from Arogya World. Having said that, the philosophies that we adopt, the total quality management philosophy that we adopt across the group companies helps employees to take charge, be empowered, and they are quite well supported. And in these times, communication is something that becomes a key aspect to ensure the anxieties are less and the mental health is promoted. So we do focus a lot on communication these days. And uh, typically, since we haven't got used to these kind of work from home practices and all that, so mental health becomes a very very important aspect in the business these days. And with the pressure on performance always being there, this is something that we need to take care of, and we are putting all our best foot forward to ensure the uh, healthy mind is added to the healthy body of people here.
Yeah. Thank you, Mr. Anandakrishnan. I'd like to refer the question to Alok Ranjan as well, please.
Thank you, Sujata. Yeah, I was on mute. Thank you, Sujata, for this great session. I think I had been listening to Professor Sekhar, and he gave a very good continuum from anxiety to disability and so on and so forth.
Yeah.
I think that's a beautiful way to put it. And coming to Times Group, see, we are in a different kind of industry. It's a nocturnal industry, to say it so. When the whole world sleeps, we work so that you get your morning dose of news, views, facts, and analysis to prepare you for your day.
True.
Now, this creates a very different kind of work environment. And care and compassion being core to our value systems, this mental health has been part of our effort to help employee through our employee assistance program, through various methods for quite some time. And as we said that mental health has become much more important now. So if you look at, it starts with an anxiety, and which is very common in work life and personal life as well. In work life, it starts with anxiety about your work, your performance, your inclusion, your recognition need, and so on and so forth, which is very common and acceptable level. But the moment it crosses a certain limits, it starts impacting his productivity and hence the organization. So if you look at this way, at this point of time, see, we all are human beings, and it's our nature is very way where we can't live with other person. And especially in India, as Santosh Desai says, we love crowds and we source our energy from people around us. Now, suddenly, this pandemic had changed the whole way of working. Suddenly, we say, no, don't work with the other person. Don't go near to the other person. So it changes the whole basic understanding of how you live your life. And that creates huge anxiety, especially when this pandemic started. We started asking people to start working from home. Those who are not into the critical value chain, which is creating the paper, printing the paper, distributing the paper. But that created huge resistance among employees, because it created anxiety about their work, about their social life, about the way they are being seen as a person, in the organization, as well as outside. Because the moment you ask anybody if he says he's working with Times, people directly associate him with nothing but that he's part of the news chain. So it created a lot of anxiety, that one, and and thankfully we were very prepared, because we had our own programs for employee assistance for quite some time, and we were prepared for that one. So we created enablers on one side, and we supported employees through various programs, through information, through giving them support in terms of psychological well-being. We have a panel of doctors and psychologists, both in-house as well as through our allied partners, and through which we supported them through this entire journey. And I think we have been able to live with that onslaught of pandemic quite well.
Thank you. Himal Tiwari and Kranti, Dr. Kranti, would you like to add anything?
Okay, thank you. Look, I think very interesting perspectives since morning. And as regards our company, let me just share with you that, look, some of us did not have the luxury, and some of, we talk about being in essential services. So the power has to be produced, has to be distributed, has to be maintained. So, and that actually, was a huge challenge at one time. Which in some small measure is something that we have developed our muscles to fight this in a small way. What Chris was mentioning is that, look, the short-termism of the situation, I think we are pretty much, been at it for the last 7 months. Now, having said that, the lessons that we've learned is this is a N is equal to 1 execution strategy, and addressal is similar, because you have to just go down, as perhaps Alok is also mentioning, that you have to cut and slice the organization in addressable portions. That where are you working in? For us, these are some 6-7 of them, and I just maybe want to just mention that to you. Look, also. Look, we run townships, we have plants, we run townships. It's a completely different, management there, because you're not only managing workspaces, you're managing full townships. So your risk profiles, your ability to manage that is looking at full populations, right? And not only that, you are working with because also you have responsibility towards the local population as well, because they are looking up to you. So you just are starting to take over, townships and towns, and managing that. So that's one addressable piece. The second is that, look, we have of course people coming to plants. How do we manage that? Third, we have employees going in on maintenance work. That maintenance will not stop, and they will go into areas like they are not in slums and all of that. So how do we protect them?
Right.
Because the network has to be maintained.
Right.
But the third piece is, look, we also have renewable sites which are in back and beyond.
Right.
And we had very interesting things that because of you are 2 or 3 employees per site, and that site is maybe about 40 odd kilometers from a nearest settlement. Now those employees are in different realms of a mental state in this situation, because look, somewhere they want to go back home, right? And in some pockets, they are being seen as carriers by the local population. So there is an external stress that comes in as well. So I'm just trying to give you the definitions of those pockets.
Sure.
So you have to address it
Sure.
equal to 1 from that point of view. Now wellness is it is communication and more communication, and straight candid communication, because look, in large parts of it, we don't know where this is headed, and the share of to say that we also don't know, and with that transparency, I think everybody appreciates it, right? Now we we've had a share of 600 odd infections since 7 months.
Right. Right.
So we've been at the heart of fighting this battle.
Yeah.
Right? So we've been very transparent with it, and
Right.
we, in some measure, the answer is in the balance, and it's developing this resilience that we cannot borderline to swing into paranoia, and we cannot swing it to being complacent, because both those are actually mental states, really, right? And how do we create that interim balance to say that, look, hey, we could be working for a company that works 24/7. We will take great care, but we will also be prepared that some of us might get that infection, right? Now, it is.
I can't.
Yeah, and how do we manage it subsequently is the faith that you must have in the system. So
correct. So my question to all of you, sorry to interrupt you. I think we're running a little short of time, so I'm trying to get as much juice out of all of you here as possible. The next question that follows logically then, Himal, is, do you have mental health prevention programs in place to help with sleep disorders, depression, anxiety for leaders and employees? And this is all of you, but since Himal is talking, we can start with him first.
No, we all of us have. We've been running this for the best part of, we've been associated with this fantastic organization, and we've been awarded as well for many, many years. So we run this program for the best part of last 11, 12 years. It's just that the focus for the sheer awareness of it is what we had to do. It is again coming to how sensitively we position this. It's not a mechanics that, look, we have an EAP partner, go, this helpline is there, and, figure out for yourself. It's almost a leadership speak to say that, look, we understand these are difficult times. We understand we all have difficult, context back home. We understand there is anxiety, but hey, this is one of them. So it's a little bit of this soft messaging that was required, a very careful position messaging to take this bunny out of this thing that, look, hey, is this something wrong with me? Kind of a thing. So we do have it. We've seen a significant uptake. We have our HR processes to monitor it in a very structured way in terms of our criticality of responses, and our business HR works very seamlessly to enable it. Yeah.
Great. Thank you. Mr. Anandakrishnan, I think you were trying to get a word in.
No. I just wanted to add on here. Wouldn't take too much of time. So I would say that here I talked about communication being the key, and the managers and the leaders being quite empathetic. And towards this, we have put in place the employee assistant programs that we ran ourselves. In the sense, right in February end, when we had a view of what's going to happen, we created something called TVS ICE as an app in case of emergency. The ICE is in case of emergency. And we ensured that we have about 15,000 people spread across the country. And we had location leaders who were responsible to connect with each of the employees. And we made sure that all those 15,000 people were connected every week. And we got feedback from them. And we created a lot of, programs in a way. So some people wanted medicines to be delivered at home. Some people wanted cash to be delivered at home. Ensured that all those resolution mechanisms were put in place within 6 hours time from the time an employee raises a query or a support request on this app. I would only add on to that. And then as we started working more from home, we started working more on introducing newer programs which focused on mental health. We have a series of workshops that run on a name called Health Wholesome, where every week we have few hours set aside for the employees and their families to focus on both physical and mental health.
Oh, that's interesting. Dr. Kranti, what are you, I'm sure your experience, the CIPLA Foundation has also been, shown you the impact that this pandemic has had on mental health, right? If you could share your insights
Yeah,
and
no,
what
thanks. Thanks, Dr. Sujata, and thank you, Arogya World, for this opportunity. Let me, compliment and congratulate Arogya World for bringing this NCDs on the center stage, number one, and also including, mental health issues henceforward. So, many congratulations for that, number one. Number two, there was a, study, I don't know, probably you must be aware, something called as global burden of disease data, which was, analyzed and in India from 1990 to 2015. They looked at the various diseases, and we all know, I'll not go into detail, but there was a transition from, this is the diseases and the people dying. So we call it as mortality and morbidity. So if you see the people who were dying in 1990 and 2015, there has been a shift from communicable disease to non-communicable disease. So very clearly, non-communicable disease is the area which one has to focus, number one. Number two, within the NCDs also there are various diseases. I'll not go into detail, but mental health, I remember 10 years ago, WHO said, World Health Organization said in 2020, that is now, that every fifth person will require some psychological assistance. And we are in 2020, and probably now, slowly, probably we are realizing that how mental health is important. Number three, I don't think so anybody can ignore mental health as of now. So we are speaking at workplace, how do we deal with this mental health issues? And we are speaking that how do we, tackle this? Now the main issue, the crux, I hope Dr. Shekhar has already, pointed out, flagged some issues. But right, first is the how do we identify? Second is the how do we access the right kind of people? There are a lot of myths. That is one another, issue. And the most important issue, is there any way to prevent? We are speaking of, say, for example, mental health issues. If there are, we tackle them. But how do we prevent those mental health issues? And lastly, coming to Sujata, to your question, that yes, CIPLA is also, like many other my colleagues on the panel has already said, though we are also a pharma company and a foundation, so there is no way. Some of them were at work from home, but like this being a pharma industry and a life-saving, you know what the issue was. And CIPLA has all the, range of drugs required for the COVID as of now. Right. So, maintaining their health was a prime thing. And of course, providing mental support. So we had an, agency in-house, and we had a task force, like what other my colleagues have mentioned. A lot of support for diagnosis, admission required, quarantine required, and all of the support which everybody has said is there. But one thing I liked is everybody said that the connect of your senior leadership with the workers, that was, I hope, a key. Yeah.
Okay, great. Thank you so much. So, you mentioned the current scenario with COVID-19. Mr. Anand Krishnan, I had a question for you and for the rest of the esteemed panelists, of course, is that, managers need to be trained to be more empathetic, more compassionate, and understanding during these times for obvious reasons. Is there a program in place to train the managers?
Yeah, of course, that goes without saying, because they are the ones who are much closer to their people. So one, we have a very clear work from home policy that very clearly states how somebody behaves when they are off work, when they are off physically. It is also that we have quite a number of mental health, as I said, mental health programs like transcendental meditation, and we work on a program called Saptaswara, which links the mythology to business, and this health wholesome series that we spoke about, which is for the families and also for the employees.
Very interesting. Yeah, very interesting. Yes, I think this is, you have to have a creative way of addressing this, and I appreciate the policies TVS has put in place. What about you, Alok, Ranjan? What do you have? Anything you'd like to add?
Yeah, I think we need to look at mental health in a very holistic way. And at BCCL, we look at all the three aspects, that is mind, body, and soul. And see, as a brand also, we address these things when we cater to our readers. And so it was easy for us that we replicate it for our employee, and this has been there for quite some times. We had employee assistance program where they can reach out to a psychologist and seek the help with full confidentiality and trust, and this has been there for quite some time. And then we have a series of sessions that we conducted, especially when the pandemic hit us, where we conducted sessions on various aspects which may be issue at mental health issue at this point of time, whether it is working remotely and how do you behave, what will be the work behavior in remote working conditions, what will be the behavior of the managers during that period, and how do they lead the team. We tweaked our programs accordingly so that we can deal with that one. We can equip our managers for that one. Apart from these learning programs and the employee assistance program, we also created a lot of enablers. So we have an app called Widget. We are partnered with Widget, which brings a whole range of medical professionals and psychologists, where through whom we not only conducted sessions on important topics related to mental health and emotional health, we also, the employee can reach out to any of these professionals for any kind of supports, whether it is physical health or whether it is mental health. Then, of course, we did offer other facilities on that one. We also, when the pandemic hit us, we had a huge challenge of how do we deal with that one? How do we support all employees? And we created a COVID health emergency response program. And we had already had a tie-up with a vendor for, which we call Red Button. So Red Button is for any kind of emergency. We have an app, you have a red button there, you press red button, you get your support there. So we had created this for all kinds of, whether emergency doctor on call, whether it is ambulance, you get it in defined timelines. Then in order to help facilitate that people, those who are coming to the workplace, they are safe and the others are safe if somebody is getting infected. And so we created in-house created an app so that we can monitor the health of the employee if they happens to come to the workplace. So we created a lot of enablers. Then as we ask people to work from home, we also created a lot of enablers. How do you? Because everybody is hooked on to coming to the office and work. So while IT infrastructure did help from physical perspective, but when it comes to mental perspective, you have to do a lot of communication, as Anand also said, and earlier speakers were saying, communication plays the key role. You have to communicate, make employee comfortable, feel at the organization with him in all circumstances.
Great. Yeah. Communicate. Yeah. So, we all know that, like any other program, wellness programs need to have structured outcome measures to see if they're indeed doing the job, right? It's one thing to put them into place, but it's another thing to see if it's impacting the employees the way that you want them to. Do you have such measures in place? Do you have ideas for them? And if you actually have them in place, can you please describe them? Perhaps we can start with Dr. Kranti. Maybe there's something in the foundation that he could share with us that would be of...
we have, thanks, Dr. Sujata. We have a very robust, performance evaluation, system. And of course, that is, a participatory one. Decided at the beginning of the year. We work with them and then we define, we may call it as goals, KRAs, performance indicator, whatever you may call. It may differ from organization to organization, but definitely there is a measurable outcome which is expected from a particular candidate. That is number one. Number two, then we also have processes to evaluate every quarterly also. That every quarterly, how is that performance going on? And our managers also connect one-to-one, so that unnecessarily that team member is also not embarrassed if he or she is not performing well. And just a small point on the earlier discussion we were having, like we also have external agencies so as to ensure that there is a privacy where our staff can approach them 24/7. Now, big issue is because there is so much of myths and so much of stigma. So it's really an issue that how many people really who want are accessing those helplines. So what do we do for that? So one additional thing and best thing probably what our and my organization currently is doing. So for example, the manager, maybe not necessarily because of performance, but otherwise during his or her informal interaction can just gauge that whether that person is having stress or some other issues or family issues. So proactively, we can suggest, I mean, our manager can suggest that some of my colleague or employees probably having this sort, and that agency will call that and take the consent. Of course, this will happen only after consent.
Right.
And then they'll offer proactively the support. I hope that kind of proactiveness from the agency and giving that right to manager is also an important part. Thanks, Dr. Sujata.
Sure. Mr. Himal Tiwari, would you like to add anything to that? You're on mute, sir.
Sorry for that. We have measures on measuring effectiveness. Just to what Dr. Kranti also mentioned is we have made manager also the second in line to pick up early signals. So while they may not be completely be equipped to decipher the signals from a diagnostic point of view, but we've said pick this up anytime, and we also have enabled a technology connect, which is made deliberately less structured, so that look those gray areas which don't come into the classical definition of work, classical definition of output, classical definition of work hours and what have you. So those can be brought in that connect, and that connect gets filtered to business HR, and then we figure that whether it's a counseling issue, and then or it is we also do this formally, referring it to our EAP, platform. So that is the way we do this, and it's done on a quarterly basis.
Makes sense. I wanted to ask you, Mr. Alok Ranjan,
Sujata, can I add to?
Sure,
yeah,
please.
On this topic itself, see, mental health, we all have agreed that people don't open up to the mental health issues. So when we talk about measuring effectiveness of a program on mental health, we have to be very cautious. So the moment you put a measure, you try to drive that measures. That's the very usual performance cycle. So here my take will be when your openness and your acceptance level is fraught with so much of social issues, our efforts should be how to get it accepted and how to get it utilized. And that's where, while no organization will like to say, monitor that how many people are using an employee assistance program. No, that's not the right measures. But we understand that, yes, large number of people are not using it because of the stigma. So while we don't monitor things like that, but we do keep a tab on whether the program is well accepted or not. When we run a program on, say, we are a nocturnal organization, as I said in the beginning. Sleep is an issue for some portion of our employee population. So we conduct a program on that one. Now, the people who are the right target population, whether they are attending these programs or not, and whether there is a health issues coming up in that population or not. So we do a lot of such correlations to do that one. So I like to put a caution here when we run this program. Putting a measure should be very, very done very, very cautiously, and we should not drive measure, because no measure should increase, rather it should decrease, because the moment we start seeing that one. But at the same time, it also will be an indicator that are people accepting, are people coming forward or not.
Yeah, that makes sense. I wanted to ask you as well, is there a success story in your wellness program that you'd like to share with us today? Or an experience that our audience can learn from? Because the whole objective of this exercise is for us to learn from all of you. So
I think we have done a lot. I think Arogya World also has recognized, and many other external agencies have recognized us. I like to say that we need to look at every aspect of well-being. And that's why I said mind, body, and soul. And I like to just narrate few things, and I'll not take much of time. If you look at the way we approach, I will like to do that one. That we have clubs, wellness clubs. We have our HR-led programs for various kind of health programs. We have enablers. We have various awareness sessions. We have various tools which equip employees in terms of various kind of guidelines, do's and do nots, FAQs documents, what to do in what kind of circumstances, so that people feel that, see, as Himal said, that they are into essential services, so are we. Let's accept the fact that employees will catch COVID. It's very difficult to say that one and accept that one, but that's the reality. And all of us will have to prepare our employee to manage if they, and create support systems for our employees so that they are able to manage it. That fear, that anxiety that I will catch should go away, because he's confident that even if it happens, the organization has created enough enablers and mechanism so that he can deal with it without any problem. So you have to look at every aspect, from equipping him with information, equipping him with systems and processes which help him to deal with the scenario, various support systems in terms of insurance, in terms of employee reach program, in terms of how and which that emergency response team, and so on and so forth, so that they are able to deal with that one. On learning side, we created programs, as I said earlier, which help people to know more about it, how to deal with this kind of scenario. So we have e-learning programs, we put certain things out there, and we conducted a lot of sessions in that way. So I think a large number of things happen from in all aspects, all area.
Yeah. So you need to address all the various pillars.
Yes.
To
important is you take the anxiety out of the mind of your population, because some of them will not go to the office. Some of them will not step out for work purpose, because you will have some population, you will not like them to come out, and some will. So this will create anxiety. Why me? As Himal was indicating, and we have to equip them with everything so that that anxiety is taken out of the mind.
That sounds like a very thoughtful and robust program. Mr. Anant Krishnan, would you like to add to this?
Yeah. So if you talk about success here, there are a lot of things that are ongoing, and I'm sure we would see them quite successful as we go forward. But a few things that I would like to highlight here is all about we as the leadership team, and some of us that worked significantly through the April-May period to make sure that we worked on about 1.2 million food packets for the paramedics and all those people who are the COVID warriors.
Right.
We worked on about 5,800 villages and made sure that the Bharat does not get affected by this pandemic. We used our facilities during the lockdown to make about 1.2 million masks, and those were handed out to the needy. This is something that we in a corporate life, we typically tend to work through our sales, profits, margins, etc., etc. But this is something that we would deem it as a great success, and we as a team are really proud of what we have done during this April-May period. Having said that, the kind of programs that we put together and got all people together, the Q2, the quarter that went by, has been the best ever quarter for TVS Motor in terms of sales and margins, and which also goes on to prove the impact of whatever we have done to the people and the society at large, how it is helping us to be better as people and be better as company.
That's great. No, that's great to hear. Mr. Himal Tiwari, would you like to add to that? And then we'll take questions from the audience. I think
very wonderful sharing across other colleagues. I just want to share a couple of things that we did, and which we realized that, especially this may be true for a whole lot of us on the panel. Look, we are a legacy company. We are a 106-year-old company, less than 3% attrition, multiple generation work in the same company. Now, a key element of emotional mental health is what tends to be that, look, organizations provide that social and the connect. Look, it's a proxy for attachment. And what tends to happen is that, look, once you take that away, the anxiety comes in, and how do we manage that was a key element to that. Another thing that we have initiated is how can we bring in informality and humor as a part of our messaging. It's a very important look. I may not look. We are a little traditional sector, so tends to be hierarchical. We look up to our leaders and all of that. Now, in these times, we should know our leaders in a different lens. So a lot of those programs to make those narratives informal, humorous, less tight, as it were, was a key element to make sure that we are communicating seamlessly. This is not official stuff, right? And for us, it was a clear cultural paradigm that we were addressing in a new way, saying that, look, can I know my leader, who is my vice president of or whatever, one of my businesses? He's telling that, look, what is his vulnerabilities? What is his things that he's doing when he's stressed out? So the humanization of the communication was also a key pivot that we made, and we've got a huge success with that, because we've had a lot of employees coming in, new types of communication, new connects, and I think that was the objective of that program.
Okay, fantastic. Dr. Kranti, did you have anything to add? You are on mute, sir.
Yeah. Fine, thanks. No, I hope considerable, comments have been made, and it seems that, whatever the workplace systems all the corporates have, probably, they are working and they are reaching proactively. I just make 2-3 suggestions for everybody to think on, and then probably you can take on. One is, I hope now in the COVID times, we all know that we have moved from the concept of illness to wellness. Now, how do we are focusing more on the wellness rather than illness? So similarly, if we apply this to mental health, so, and like probably Dr. Shekhar was mentioning the definition of health.
Right.
So absence of disease does not mean that you are healthy. So similarly, absence of any mental diseases does not mean that you are mentally healthy. So there is something more for you to be mentally healthy. So that is the concept probably we need to bring into it. And one beautiful concept probably we all know is the emotional quotient. So is there a way for an employee to get his or her own emotional quotient checked and do probably some things on that? Probably those tools for wellness of mental health could be thought of. This is one. And secondly, I don't know, probably one of the key, I hope, preventive strategies, and which one of the greatest therapies currently is there, is the rational emotive behavioral therapy. This was, propagated by Albert Ellis. There is a big, everybody now follows that. If some kind of courses related to REBT is given to our colleagues, probably they'll be in a better position to prevent mental illnesses and equip wellness. So probably this could be few things we could think on. Thanks, Dr. Sujata, for the time.
Yes, I know, this is fantastic. I think we don't have any questions from the general audience at this time. It was wonderful to be able to have this panel discussion with all of you. I think there are lots of take homes for the people listening. Thank you again for your time, and take care, stay safe, and stay mentally well. Thank you.
Thank you.
Thank you very much. And thank you, Arogya World. Bye-bye.
Thank you. Success.
Thank you, Sujata, and all the panelists for an excellent discussion on the topic. By investing in emotional and mental wellness benefits, employees are going to create a human-centric workforce that drives retention, productivity, and engagement. Now, we are also going to see the response for the poll question that we posted. Which lifestyle habit causes most deaths across the globe? And from our audience, response has been like all 100% response. So unhealthy eating is at 56%. We have physical inactivity at 26%, tobacco smoking at 15, and lack of sleep at 3. So most people in the audience, including me, I think we agree that unhealthy eating is probably the primary reason why most people have challenges which become chronic illnesses over time. So now, in the best interest of time, we'll move on. It's indeed a great pleasure and honor for me to introduce Dr. A. Velumani, who is now going to deliver the keynote address on importance of NCD prevention in the workplace during COVID-19. Dr. A. Velumani owns and operates Thyrocare, which is now a household brand which you and I are familiar with. He began as a mathematician, became a scientist with a PhD in thyroid biochemistry from Bhatt Mumbai University, now a celebrated entrepreneur too. The Thyrocare network serves 10,000 cities and towns in 10 countries. His clinical laboratory services conducts approximately 4 lakh tests every single day. Dr. A. Velumani proves amply clearly to the industry that focus gives success and frugality gives sustainable success. He's an infectious motivator and storyteller with a terrific sense of humor, which entertains, educates, empowers, and encourages the educated to become entrepreneurs. Over to you, Dr. A. Velumani.
Thank you. Thank you, Soumya. Thank you, Ashwini, for connecting me to this forum. I will talk overall about the employees' health. I was an unemployed boy, became a private company employed. Then that company closed down, came to Mumbai, then government employed. Then I resigned. I was self-employed. Then today I have 8,000 people working under me. So I see from 360 degrees what employee and what employer and what health, what workplace, all can be summarized in a very simple way. If a man works for 40 years, first 10 years it is purely distractions, which is his ill health. The second 1/3 is the peers, the jealous, the challenges contributed by peers is spoiling the health. Actually, the last 1/3 is health, body, because until 40, body is in full shape and all other problems become problem. Then in the final stage, health becomes what you have, pains in your angles, various other parts of the body. I have seen thousands of employees, overall poor employees, employees from poor families are happy employees, healthy employees. People who have lived in luxurious environment till they become employed have problems from the day they start as an employee. People from village have much comfortable, much enjoyable working environment. Environment doesn't change. They see the environment as enjoyable. Children who have started their career with EMI are suffering a lot from the very beginning itself. EMI is the biggest health hazard in our workplace. Fortunately, I never had an EMI. Personally, I have never borrowed. Today, I run a company. I have not borrowed for the company either. So I must tell you, if at all there is a single parameter which causes stress, which in turn causes health hazards, it is EMI, and make sure that it is not troubling. Neighbor is the biggest stress. I have seen this. I think Padosi, if you do anything to impress the Padosi, the EMI goes up. If you do anything to show to the Padosi that you are great, this mental stress, you will not be able to sleep. So take care of your neighbor. Qualifications very often is a stress. Very often an MBA has less knowledge than a BA. Very often an engineer has less knowledge than a HSA. So the qualifications very often becomes a big distress. I have a punchline. Qualifications without knowledge is a liability. Knowledge without qualification is an asset. Knowledge and qualification is prosperity. Very often designation becomes the biggest stress. Having the designation is a stress. Not having that designation is another big stress, which I have noticed because I was an employee. Now I'm an employer. I can look it from both sides. Very often salary is the big stress. When I tell salary, not having salary is an ordinary stress. Having that salary, which if you lose, you can't survive, is the biggest stress. So keep in your mind, too high salary very often gives too high stress. Lack of focus is stress. Very often employees don't have time to look into priorities 1, 2, 3. There is a saying which I have recently read. If your 1, 2, 3 is in order, you don't have to work for the second half of the day, month, year, and life. So that means you must have your 1, 2, 3 in place. Very often people fail to keep 1, 2, 3 in a right order. Lack of focus results into lack of performance, and lack of performance leads to lack of appraisals, and lack of appraisals lead to too much of mental stress. Bandwidth of a person is most important. You must be wondering, what is this bandwidth? If you have more time, you have more bandwidth. If you have more work, you have less bandwidth. Please note, bandwidth plays a very big role. Having money means you are rich. Having time means you are wealthy. Make sure that you have time. You have time for you, for your boss, for your child, for your mother, for your parents, for your friends, everyone. Time is ultimate in life. Only wealth we have. Please make full use of it when you got it. Peers is the biggest problem because uska sadi, meri sadi se safed kyun? This is the biggest challenge for workplace and people. I have seen in my own organization, some employees are suffering from morning to evening, not because of me or their superiors. It is because somebody parallel to them got a recognition which they couldn't get. Trust me, you have to isolate yourself from all such pains. Well, one must think adequately. There are some people who only work, they don't think. And if you don't think, you can't grow. If you work, you can survive. जो काम करते हैं वो बुढ़े होते हैं, जो सोच के काम करते हैं वो बड़े होते हैं. Of course, you have to learn. People believe after 25 there is no need to learn. Today I am 62. Trust me, even today, learning is very important. Otherwise, my Padosi will be ahead of me. Learning gives knowledge, and the knowledge gets you recognition. Once you get recognition, you can celebrate, and only when you celebrate, you can enjoy. I have seen in good number of offices, politics is allowed. The CEO or the promoter is ignorant. Promoter has no time. Lot of politics played in various hierarchical structures. Politics, if it is there, it can ruin the happiness in the workplace. Happiness gone, health gone. Bullying, oh God, it can be any extent if there is no monitoring, there is no supervision. Get constant feedback. Remove the ones who bully the most, even if he can be the most performing asset. Of course, there are still, even in this era, even in 2020, even in an era where LGBT is also perfectly accepted, still people are talking about caste, language, and a kind of even religion. All of them, it will ruin the happiness in the workplace. I am of that opinion. If given an opportunity, every employee is successful. There is no useless employee in an organization. He may be useless in that position, in that job, in that particular slot. So find a groove for him, find a slot for him. I have created jobs for many people, not because they are capable, qualified, because they were fitting into that slot. There are 12 attributes I have listed in my personal way. All attributes are not with everyone. One attribute is with everyone. 2 are with majority. 3 are with some. 4 are with a very few. If 5 attributes are there, he is general manager. If 6 is there, he is CEO. There is no one with 12 attributes. Never harass anyone because he doesn't have that attribute. Please appreciate the one who has attributes. Smiles can create a great working place. Very rarely you will find people who will always smile. It's very important. The leaders have to smile so that the followers, the subordinates get energy. Skill them, create skills in them, make them to make mistakes. From mistakes, let them learn. And of course, motivations are very important for every employee to remain happy, and the superiors have to do it. The most important 2 things for any leader, be it manager, general manager, CEO, is frugality is very important, because if you wear diamond, your subordinates will be thinking of wearing diamond. If you don't color your hair, the subordinate also will not be worried about unnecessarily spending for that. I am very clear. If the leader is frugal, that organization has least stress. Humor is very important. Fire 10 times, but crack jokes 2 times. That 2 jokes can take out the pains of the all firings you have been unnecessarily giving. Coming back to health side, I will just take another 100 seconds to 200 seconds. Health is very cheap. Please don't look at the star hospitals rate list and conclude that health is very costly. Very often the health is 1/20th of the catalog rate. Please note, if you have a very big organization, every Friday call someone and ask them to do some basic tests once in a quarter for your employees, and make sure that a 500 rupees a quarter is spent on that employee to get the vitals, basic vitals diagnosed, so that they also feel they are cared for. To make an employee happy, to keep the employee workplace very, very enjoyable, first there should be a good business. If business itself is not doing good, if business itself is creating losses, there can't be any happy environment. A good business, a good management. Of course, a good business with a bad management cannot give good profits. So a good business, good management, good profits gives rise to good workplace. If I get a mic, I can keep talking for 45 minutes to 1 hour. But I understand that I have been given some 15-20 minutes to talk, and the event is running late. So if there are some questions, I will be very happy to answer. I hope I have kept it simple and also a little more motivating. Thank you very much, Soumya.
Thank you, Dr. Velumani. I think from your journey, which has been inspiring to every bit that you shared insights on, be it the Padosan syndrome to the EMIs or the challenges we have, with the title, salary, and of course, the 1, 2, 3 in order. I think we should sort out our second half. So I think it was very valuable learning for all of us to kind of take away so much in this little time that you've conveyed all of it. So I'm sure we'll create more bandwidth, sir. Thanks a lot for that. Now, we'd like to take a few minutes to recognize our partners, the Confederation Indian Industries, the Public Health Foundation of India, AEOHT, that is, Global Health Center for Healthy Workplaces, Infra, GAX, Mana Wellness, NHRD Bangalore, and Cigna, who have stood by us through all our efforts. We could not have achieved so much without the able support of so many companies who are like-minded agencies and foundations. We are happy for this encouragement from our partners and grateful for their partnerships. Now, talking a little about CII, The Confederation of Indian Industry celebrated its 25 years of existence in 2020 and works as an apex industry body with a membership of over 9,000 companies spread across its 68 state offices and an indirect membership reach of over 3 lakhs. CII's focus in healthcare creates value for Indian healthcare sector by increasing sustainable interactions with governments at the center and state and catalyzing increased engagements among stakeholders towards improved patient care and health for all. The next organization I would like to talk about is PHFI. It's the country's largest public health advocacy group, working with many state and central government departments on health projects. The third one is Cigna. It's a global health service company offering health, pharmacy, supplemental insurance, and Medicare plans for individuals, families, and businesses. NHRD, the National Human Resource Development Network, India's largest HR network, in its more than 33 years of existence, has played a catalyst role in preparing the leaders of today and tomorrow. Now, I request the team to have our partner videos to be shared.
Hello, I am Wolf Kirsten, co-director of the Global Center for Healthy Workplaces. The Global Center is the host of the Global Healthy Workplace Awards and the Healthy Workplace Certification. The Global Awards are held every year and attract applications from the world's best employers. Last year, Hero Motocorp from India won the Global Award in the Large Enterprise category. Congratulations again. We collaborate with partners in a number of countries where we see a good fit. Arogya World is such a partner. We very much value our partnership with Arogya World and commend the tireless work they are doing to make workplaces healthier and reduce non-communicable diseases in India. This year has presented us with major challenges in form of COVID-19, and the significance of healthy employees and workplaces has reached a new level. I encourage all of you to take a strategic and comprehensive approach to workplace health and safety and take advantage of the guidance and resources Arogya World offers. I wish you the best of success.
Any country's economy is dependent upon its industries, and industries are dependent upon its workforce. A healthy workforce is therefore the need of the hour. To discuss this in detail here, we welcome you to the biggest gathering of occupational health specialists in this part of the world. It supports Indian Association of Occupational Health mission to enable occupational health professionals to make India's workplaces healthy, safe, and green environment, free from the ill effects of hazards by evolving effective solutions to be the nodal non-governmental organization committed to attain the highest standards of health in India by enabling stakeholders, influencing policy makers, and creating community consciousness. India contributes 17% of global population and is the third largest economy in the world. The contribution of India is set to increase. Occupational health in India is relevant to the future of occupational health in the entire world. Indian Association of Occupational Health mission promises to be an impactful and memorable extravaganza of one of the biggest professional conferences and exhibitions held in this part of the world. New Delhi, India.
It is our pleasure to introduce Global Association for Corporate Services, an association passionately driven by people, processes and technology. Global Association for Corporate Services, or GACS, as it is popularly known as, is a forum of working professionals across corporate services domain which was formally announced in January 2017. The forum provides information, knowledge management, crisis support and networking platform. The endeavor of setting up this forum is to establish robust processes with the use of technology and provide distinction to the members in society and nations at large. In the dynamic environment that exists in our industry today, GACS will provide end-to-end solutions far beyond the existing norms. Corporate services in the larger role defines the way governments of various countries work and make the ease of doing business more approachable to the entrepreneurs. GACS as an association focuses on key issues pertaining to corporate services domain, thereby assuring business houses a hassle-free and smooth operating environment. Real estate services, facility management, sourcing and procurement, travel, hospitality, transport services, sustainability, security and investigations, business continuity management, disaster management, and multiple other functions are its councils of excellence. The horizontal pillars are education and training, innovation, industry affiliation, and startup support. All this is promoted under the highest levels of business ethics and values in keeping with international standards. Corporate services leaders from various parts of the country belonging to various sectors and backgrounds applauded the launch of this forum. Members here are forthcoming, communicative, and interactive, which ensures that they learn from the leaders in the association. Members also highlight issues which are in the interest of the nation and which further helps to create a smooth business. And to know more, log on to gacs.world and join us. Global Association for Corporate Services. People, processes, technology.
Hello, greetings from Mana Wellness. I'm Ashwin Naik, one of the co-founders. We started Mana with a mission of creating a platform for mental well-being, which can support individuals, small companies, and large organizations. And one of the challenges that we have all faced is when we start on a mission like this, organizations really struggle on finding where they stand in terms of their own mental health preparedness and what are the interventions they should bring in. I think this new initiative by Arogya is really timely and critical, and we are delighted to be partner with Arogya World. This is such an important topic at this time, and Arogya World is the right organization to take up this challenge, given their experience and credibility of running the Healthy Workplaces Award and challenge for so many years. I think organizations will benefit immensely from this exercise, and we are very proud to be a partner and a small part of this initiative. It's also more important for us to be part of this initiative because mental health is an area which cannot be tackled. Mental health challenges are not possible to be tackled by one organization or two organizations. So we have to all come together as a group and focus on this important topic. So we are very delighted and excited for what's coming up from the Arogya World team. And I'll also take this opportunity to thank and congratulate the Arogya World team, which has worked tirelessly to get this assessment and mental health at work methodology to this stage. Congratulations and all the best. Thank you.
It's truly gratifying to see the kind of effort that has been put in by these organizations. We're sure they will continue to inspire many more organizations to get on this path. Now it's the KBC style time again for us to bring in our audience for the second poll. The question or every 60 to 90 minutes, or every 5 to 10 minutes. Yeah, I think you should reflect upon your routine and, of course, see, have you really taken those breaks while at work, while managing multiple things at home, and while the home is again manifesting to be a workplace, come a school, come a playground and a restaurant. So give it a thought before you respond, and we'll come back with responses soon. Okay, 15 seconds are up. And now I invite Ashwini Thakkar to felicitate all the winning companies, Arogya World's proud healthy workplaces. A little introduction about Ashwini. She is a seasoned healthcare and employee wellness management professional with proven leadership capabilities and a rich career spanning nearly 20 plus years in leading organizations. Core competencies including leading teams of occupational health professionals, customer service, enterprise-wide and cross-geography communication and sales. Ashwini joined Arogya World a year and a half ago from Johnson & Johnson. So here you go, Ashwini.
A very good afternoon to everyone, and thank you, Soumya, for the kind introduction. I'm sure that each one of you have found the earlier sessions very insightful and inspiring as I have. We now come to yet another interesting section of this conference. Um, Heartiest congratulations to the 14 new healthy workplaces which have joined Arogya World family in this year. Given the extremely challenging circumstances, the determination and zeal of these companies need to be highly appreciated. We wish them success in their continued endeavor towards improving employee wellness. We would also like to extend our sincere gratitude to all our assessors who have volunteered their time to enable this accreditation process. Without further ado, let me call in our winning companies. BCCL, Bennett Coleman and Company Limited, is one of the largest media conglomerates built on a strong legacy of 180 plus years with a mind of a startup having 108 publications and 118 offices across India. Innovation and improvisation, agility and adaptability are the hallmarks of their progress. Their employee interest club, created by the employees for the employees, to inculcate a health and wellness movement within the organization, is worth emulating. AV, please.
I'm delighted to know that our efforts to drive the total wellness quotient in our organization have been acknowledged through this award. So I'd like to thank Arogya World for not only bestowing this honor on us, but also reinforcing our belief that a healthy workplace dominated by a healthy workforce leads to consistent business success. So this recognition not only enhanced our motivation to set even higher benchmarks for the coming times as well. So as one of the largest media conglomerate in the country with over 185 years old history, we firmly believe that our people are not only our most critical asset, but they are also our extended family. So this has been the driving thought for us to invest in programs and interventions on a continuous basis that promotes total health and well-being of our employees. So this period of pandemic and an extended lockdown that we have witnessed has been highly stressful for all of us. We are all worried about our health and safety, have had to adjust to new ways of working, and have been extended isolation from friends and colleagues during this period. So at times, we promote health and well-being. Our objective has been to proactively design and implement programs that focus on building a positive mindset and promote healthy practices. For example, we have focused on ensuring a balance of mind, body, and soul through our umbrella initiative called In It Together, which promotes a sense of belongingness and togetherness amongst the employees. We have also made extensive use of collaborative technology platforms to ensure round-the-clock connectivity and access to our employees. which provides social proximity in a physical distancing era. As a media organization, since we are classified in the category of essential services, which provides credible and authentic news to our readers and viewers, we have to ensure continuity of holistic well-being of our employees through plethora of wellness programs and initiatives. So this has fostered development of agility and resilience in our workforce, not only for business continuity in these unusual times, but also to build a fit for future organization. So going forward, as an industry leader, we firmly believe that it is our responsibility to introduce innovative practices that promote total health and well-being for not only our own employees, but to set new benchmarks and best practices for the entire world of business. Please stay safe and take care.
Cummins India Limited is a global organization with presence in more than 190 countries and territories. Cummins develops, designs, and manufactures products across 6 continents. They manufacture engines for trucks, buses, and specialty vehicles, as well as engines for equipment and machinery, along with generators and engine components. Their framework, their health and wellness framework, includes 7 levers of healthy lifestyle, namely physical activity, nutrition, sleep, substance free, stress management, clean water, sunshine, and clean air. Cummins follows a unique practice of providing a travel health risk assessment program for their employees who travel internationally. The next one is Thermo Fisher Scientific India. They are a world leader in serving science with a mission to make the world healthier, cleaner, and safer. The company's emotional well-being initiative, Oh Mind Relax Please, is a notable approach which includes mindful nuggets, engagement through habit formation to drive positivity. Do it yourself Yammer, where employees follow a positive behavior and encourage others also to follow the suit. AV, please.
Protecting the environment, health, and safety of our employees are non-negotiable cornerstones at Thermo Fisher Scientific. We continuously seek new ways to improve our colleagues' work experience. We've taken deliberate and a thoughtful approach to ensure the physical and emotional well-being of our people. Over the past few months, we've expanded our mindfulness program to offer alternate resources that help employees manage stress, cope with anxiety, and reach out for support as we navigate through the tumultuous situation. I'm happy that our colleagues have truly valued our efforts, and these initiatives have been instrumental in bringing about a cultural revolution slowly and steadily across the organization.
Juniper Networks India Private Limited provides high-performance networking and cybersecurity solutions to service providers, enterprises, companies, and public sector organizations. Ergonomically designed workstations to suit individual requirements, mandatory employee training certification, ergonomist visits accompanied by evaluation are other noted efforts of the company towards sustainable employee well-being. Company conducts marathon like a big fiesta for employees and family with pre-training sessions and tracking kits. Bike to work is encouraged, which has resulted in extending the space to park bikes. The next one is EXL Private Limited. EXL Service is a business process management company which integrates operation management services, analytics, and technology platforms to deliver speedy results and long-term business impacts. Area area of concern and activity started during lockdown highlighted certain focus areas around which the company's global wellness strategy was designed and implemented. This is a great effort. EXL follows an exemplary COVID-19 protection protocol managed efficiently by specially constituted task force. dedicated medical advisory helpline for EXL employees and family members, gives great confidence to all employees. Tata Projects is one of the fastest growing and most admired infrastructure companies in the world. Their expertise is in executing large and complex urban and industrial infrastructure projects. Among their various health initiatives is a unique program called Moodometer, which is a practice worth emulating. A program which provides a second career opportunity to women returning to work after a long break in their career is a practice which should be certainly appreciated. Orus. Orus is a global leader in servicing payment processors, retailers, healthcare, digital marketing providers, etc., with innovative leading edge software solutions. They have initiated a structured, outcome driven employee health and wellness program and branded the same as Atman. Atman emphasizes on physical, emotional, social, spiritual, intellectual, and mental well-being. Adani Hazira Port Limited. Adani Hazira Port Limited is a multi-purpose port based on the western coast near Surat. It mainly caters to Gujarat, MP, Maharashtra, and Rajasthan-based customers. APHL handles all range of cargo. Highly employee-centric company, takes special care on employee healthy eating habits, has a nutrition blog on Microsoft Teams where people post information on nutrition and experts answer queries from employees on various related topics. To foster and promote physical activity among employees and to motivate them to stay fit, AHPL distributed pedometers to employees and organized a company-wide walking challenge and recognized departments that clocked maximum number of steps. Infoblox. Infoblox is an IT automation and security-based company based out of Silicon Valley. It is recognized as the top 25 cybersecurity companies of 2019. The company's high-touch and caring culture stands out in the company's logo, "Your health matters to us." Get fit, eat right, and stay happy. Infoblox follows an open and transparent culture where employees are treated as family. AV, please.
On behalf of Infoblox India, we are grateful to Arogya World for this recognition. This will in turn motivate us to raise the bar on employee health and well-being as we grow in coming years. Thank you.
Thank you, Arogya World, for this wonderful opportunity. And thank you for the wonderful work that you do in the space of non-communicable diseases. May your tribe grow.
JLL is India's premier and largest professional services firm specializing in real estate. The Eat Fit lunch boxes available for employees is a practice worth emulating. The leaders encourage employees to participate in physical activities like yoga, marathon, etc., with special campaigns to encourage physical activity. They also have access to an app called Impact, which helps them to measure participation and outcomes, monitor progress, and recognize and reward employees. Rubrik. Rubrik is a cloud enterprise database organization, currently based in Bangalore with over 320 employees and continuously growing. The company's health and wellness programs are mainly driven through various apps and on digital platforms, motivating employees in a fun and engaging way to achieve their health goals. The concern of the management for employees goes beyond well-being, which is evidence of an in-house clinic with a dedicated nurse and access to an ambulance, including tie-up with a doctor who visits during emergency. Adani Katapulli Port. Adani Ports and SEZ Limited, the Katapulli Port and Encore Terminal, with an employee strength of 300 plus employees, is a modern port in the north of Chennai and a tailor-made alternate of cargo owners. Following COVID protocol and ensuring absolute safety for the employees, site preparedness accompanied by appropriate training sessions on EHS validates the thoughtfulness nature of the organization. Caring nature is also evident in various employee engagement activities, which include the families. For example, Hello Office day out for the family members to the port to see the workplace, and once a year, Family Connect. Ratnabali. Ratnabali Group is a financial investment company having its registered office in Calcutta. Ratnabali has marked its corridor path to enable its employees to know how many laps they have covered during the office hours and how many calories have been expended. Very innovative and effective initiative. MediAssist. MediAssist is India's largest third-party administrator and the preferred health and wellness partner for India's most discerning corporates across the country. It offers health benefits, administrative services, including pharmacy benefits, cashless claims management, and a host of outpatient services to the corporates and individuals under the brand name of Medibud. The company offers full body tests for employees and families twice a year and conducts health and safety risk assessments on a regular basis. The company extends protection from posture-related issues by conducting floor-level training sessions on ergonomics with a doctor evaluating the posture of the employees. That's about the 14 companies, the 14 healthy workplaces of 2020. Once again, heartiest congratulations to the winning companies. Over to Soumya.
Thank you so much, Ashwini. It's indeed a proud moment for Arogya World and the healthy workplaces. Now, let's also look at the response from the poll too. The question was, how often should you take an energy break? And the response has been quite interesting. So every 2 hours, we have 39%. Every 5 hours, just 3%. Every 60 to 90 minutes, 58%, and every 5 to 10 minutes, 0%. So this, of course, implies exactly what people must be thinking, but I'm hoping it's not something that people have just put as a good to have rather than follow. I think it's important to take those energy breaks and come back to work for better productivity as well. Now, moving on, I call upon Nandan Bhatia to lead us on some best practices rounds. A little introduction about Nandan. He is presently the senior consultant with Arogya World India Trust, a global health non-profit organization. He took this role in Jan 2020, and prior to this, he was head of admin and facilities of Britannia Industries for a decade, and he has got prior 11 years of operation and sales stint in IT and hospitality sector like HCL Technologies, Leela Palace, and ITC Windsor Sheraton Hotel. He also serves as an Infra and GACS governing council member. Nandan is one among few leaders who initiated discussing and creating the ripple effect in corporate fraternity, manufacturing industries, and educational institutes towards adopting solid waste management, for which he has been recognized in various forums nationally for his contribution towards the society and environment. Over to you, Nandan.
What a great day, power packed with knowledge sessions and celebrating companies' great works. Thank you, Soumya and Ashwini, for announcing the winning companies. And yes, to everyone, good afternoon and many, many congratulations to all the winning companies. It's a splendid work you all have done towards employee health and wellness, and a great, great round of applause. Let me take a moment to define the process of healthy workplace assessment, which is based on 5 simple criteria. These criteria that mark a workplace in India as healthy were developed in 2012 by Arogya World with the input of multiple industry stakeholders. These criteria, co-created with the industry, are about establishing a work-life balance and shifting mindset. In addition to a workplace no tobacco use policy and easy access to healthy foods, as well as opportunities for the physical activities. In fact, these criteria are organized into 3 levels, which is bronze, silver, and gold. Further, the platinum level, which is a leadership and data-driven initiative, looks at health data and aims to establish a data-driven culture around health in the companies in the country. In this section of the conference, we will be highlighting certain innovative approaches implemented by these winning organizations, and it gives us great pleasure to showcase some of the best practices followed by our 2020 Healthy Workplaces, which is being shared in the AV form. The companies which we are going to feature here are Times of India, that's Bennett Coleman and Company Limited, Thermo Fisher Scientific India, Auras Tech India Private Limited, Infoblocks, JLL Property Consultants India Private Limited, Rubric, and Ratnabali and Medi Assist. Can we have the company's best practices, AV, please?
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
आज रात 12 बजे से संपूर्ण देश में संपूर्ण लॉकडाउन होने जा रहा है। हिंदुस्तान को बचाने के लिए घरों से बाहर निकलने पर पूरी तरह पाबंदी लगाई जा रही है।
We're spending quarantine. We're spending quarantine at home.
So the past few days I've managed to acquaint myself a little bit with my 6th-string friend, and I would love to continue learning because music is a great means of spreading cheer.
मैंने फिर से अपना बचपन जी लिया अपनी बेटी के साथ।
Work from home has given me a chance to try my hands on cooking.
I've always had this inclination towards makeup, and this lockdown period really gave me some time to experiment with some of my looks which I've never done before.
A family that sings together stays together.
Remember my old-time art of origami?
It's not just the food that she serves, there's love and concern for everyone.
And the authorities, we started this initiative called Corona, wherein we have received huge and tremendous support and contributions from the public and from the members of the team. And we have fed around 1,500 families till now across the Tri-City.
At Thermo Fisher Scientific, the safety and well-being of our colleagues is of paramount importance. During the pandemic, we stepped up our support to our colleagues with regards to their safety, physical well-being, as well as a lot of importance on mental and emotional well-being. Our colleagues have access to various resources, and we have institutionalized several initiatives like Employee Assistance Program, training sessions on mindfulness and resilience, training sessions on stress management, guided yoga and meditation sessions, hobby development, as well as a lot of communication on self-appreciation through habit formation and many more. We've also acted promptly, recognizing the need for doctor online services, medical counseling, and interactive sessions with doctors. Our wellness continuum addresses all aspects of physical, social, emotional, mental, and financial well-being. This is truly reflective of our culture at Thermo Fisher Scientific, where our colleagues feel a sense of pride and belonging, and thus enable them to live our mission every single day, which is to enable our customers to make the world healthier, cleaner, and safer. Thank you, Arogya World, for recognizing us with a gold certification as Healthy Workplace 2020.
Atman Employee Wellness Program was a program initiated at ORIS to facilitate health and wellness between the employees. The platform comprises of physical, nutritional, emotional, social, spiritual, as well as intellectual wellness. To begin with the program, we conducted a survey to understand the challenges that were faced by the employees to inculcate these health initiatives in their daily routine. On getting the result, we chalked out the program for them. The program consisted of various activities such as yoga, nutrition, yoga, cycling, marathon, meditation sessions, etc. Apart from this, we also included the nutritional factor, which was the main key factor of the program. The cafeteria menu was not only completely changed, but it was also designed with the able guidance of a nutritionist. This further motivated the employees to make healthier food options in their daily routine. We also got one-on-one consultations done with the dietitian, and that led to result-oriented interventions. To make the program a little more challenging and fun, we introduced various 21-day challenges such as No Sugar Challenge, as well as No Elevator Escalator Challenge, to name a few. To continue with our endeavor and help the employees to continue this health and well-being in their routine, we have introduced an in-house app where the employee can participate in these various activities even during the lockdown period, and also help them to track their progress.
At Infoblogs, we believe your health matters to us. The new normal has broadened our horizon and brought a new perspective to the way we operate. Jerry Sternin said a very famous saying, "It's easy to act your way into a new way of thinking than to think your way into a new way of acting." With the core focus of employee well-being in our mind, we adapted, we revisited, and we reframed. All of this was done with a strong backing from the leadership. And the employee pulse at the end of it was evident. The positivity, the shift in the entire sentiment from mid-March to 4 weeks after working from home was very clear to us. And as we continue to battle the pandemic together, we are confident that together we will.
Hi, my name is Marcus Joseph, Head of Global Workplace Solutions, APAC for Rubrik Inc. At Rubrik, people are our greatest assets. Rubrik is into enterprise cloud data management company. When we thought about our new workplace, the top two objectives we thought to provide ergonomically efficient workplace and promoting right food habits. As you are aware, employees spend considerable time at office. We ensured following things to be done. We provided 100% height adjustable desks for all the employees and highly customizable ergonomic chairs. Ensured clean air by providing air filters into air conditioning system and monitoring indoor air quality. Secondly, we provided highly health food options at cafeteria and pantries. Promoting healthy eating habits is a great challenge. People tend to eat more unhealthy food. We ensured that we had a food safety consultant in the office. We created awareness campaigns, educating people about the calories of each food portions. We had a nutrition, had talks on one-on-one interactions. We created exercising slots, promoting games and ensuring enough breaks are taken during the day. We had an inclusive plan, creating a food committee. During the health crisis of COVID, emotional well-being has been an important aspect for us. We asked 100% of our employees to work from home. We provided ergonomically designed workplace and chairs at their houses. We ensured that all the leaders had connect with the employees, line managers and HR team had a connect. We provided an app access for doctor consultation, online learning sessions to manage stress, online yoga, meditation and Zumba classes, etc. Encouraged employees to take personal time off and follow a strict work schedule. It's important we stay healthy and take care of our emotional well-being. I'm happy to have done the assessment from your Arogya world and really excited that we are winning a healthy workplace award. Take care, stay safe. Thank you.
Hi, this is Sampurna, Assistant Manager HR from Ratnabali, Kolkata. I'm going to share a few of our workplace initiatives that we have taken during the onset of COVID-19, keeping everyone's safety, mental and physical well-being in mind. So number one initiative, Office Building Authority and admin team checks the temperature of all members coming to office. Anyone having temperature more than the normal are sent home. Number two, wearing a mask is compulsory. Number three, we are spraying sanitizer on the doormat. Members are wiping their shoes on the mat before entering office. 4. All bioscanners are switched off. 5. We encourage members to use the staircases instead of elevator. 6. Hand sanitizers are available at all common places inside the office. So members are requested and it is compulsory for them to use the sanitizer as soon as they enter office. Next, frequent announcements for all members to wash their hands with soap or hand sanitizer. Next, all members carry their personal hygiene kit and food from home. Next, we do not encourage any kind of gathering inside the office. We conduct virtual meetings. We converse over phone and we do not go to anyone's desk in person. Next, our organization provides work from home option to pregnant women employees even though the rest of the workforce has returned to office. Kolkata COVID booklet is available to all members, which includes the list of hospitals treating COVID patients, the list of testing centers and emergency helpline numbers. Next, we do discuss motivational quotes during the morning prayer, which keeps the mental well-being in place. Next, sample sachet containing immunity boosting herbs were given to all members. So that is all. The outcome is all our office members are safe and sound and they are practicing these norms in their daily life, and so far they are safe by God's grace. Thank you so much. That's all.
Good morning. Thank you for the assessment from Arogya World. We are delighted to be part of your healthy workplaces. To give you a snapshot on our work-life balance and ergonomic practices at MediAssist, we conduct regular online sessions on work-life balance by renowned psychiatrists. We also initiated a COVID helpline for our employees for all queries and support. We also conduct online yoga and meditation courses. We have regular annual family gatherings. We also give the option to the employees on flexible working hours and work from home option. Our workplace is designed under ergonomic standards. We conduct regular sports activities like cricket tournament, badminton tournament and other indoor game tournaments. And on the way forward, we are planning to have an automated touchless dispensers across, an implementation of shoe sole sanitizers, revised travel policy, UV light in HVAC system, weekly fumigation and fumigation whenever it is required, and bifurcation of all workplace, cafeteria and toilets with physical barriers to ensure social distancing, and CCTV monitoring to check safety violations across locations and parallel actions. Thank you. Thank you.
Thank you very much for watching the best practices of few of our winning companies. We are sure that this would provide an opportunity to all the participant companies and other companies who are watching to benchmark themselves against these trendsetters and work towards a robust health and wellness programs in their own organization. Thanks again very much, and wishing all of you the very best in your health and wellness endeavor. Over to you, Soumya.
Thank you, Nandan. That was impressive array of best practices. Corporates can have an ample opportunity now to benchmark themselves against some of the unique practices mentioned, and of course, advance in their employee health and wellness programs. Now, I just curious, and I want the audience to kind of type in on the chat window and tell us if you were to combine your physical and mental fitness and rate yourself on a scale of 1 to 10, what would that score be if 1 was the lowest and 10 being the highest? Okay, so do put in on the chat window your score, and that'll keep us also thinking about whether individuals who are caring about it are yet there or not. While we do that, we are towards the end of the event for the day, and it's my privilege to invite Sumati, the country head, Arogya World India Trust, to thank all the speakers, partners, and other participants in the conference. A little intro about Sumati is she is into public health advocacy, a development sector leader with experience in advising corporates and NGOs to manage social sector programs with good social return on investment and measurable impact. She is a former journalist and director, Sustainability Philips India, winner of ABP Award for Breast Cancer Awareness in 15 states across India, and Sabre Award for COPD Awareness. Over to you, Sumati.
Thank you, Soumya, for the very unobtrusive and lovely way that you have enabled this session, and for the very pleasant personality that you've presented today. Thank you for that. And my sincere thanks to everybody who has participated, all the companies, because that really shows your commitment to the journey of health for your employees. And I have one request: please do stay tuned to this, because we will be communicating with you constantly. This is just the start of the journey. We have so much more to offer in your journey towards making employee health better, whether it is in terms of mental health, physical health, the way you eat, all of these, in the journey to prevent NCDs. And today, I really want to thank Dr. Nalini Saligram, who started this journey 10 years ago, and Dr. Geeta Bharadwaj, who joined. And Dr. Geeta is here today, and then I am sure, Dr. Geeta, you must be thrilled with the transformation and the momentum that this journey has gained. Thank you for that. Usha, your leadership, what can I say? You put such a lovely program together and you brought your team to perform higher and higher and higher each year, due to which our expectations increase from you each year. Ashwini, your addition to the team, your connections with the external world, you're a very pleasant personality to work with, and you have really, really contributed to this conference wonderfully. Nandan, God is in the details, and you have constantly been, looking at things minutely, and they say execution, execution to its perfection. Thank you for constantly pointing out things and making us better. And, I know, Viji, that you have been working in the background and you've done such an amazing job. We recognize that you stayed in the background mostly and supported the team, but wonderful work. Shema, your, take ownership attitude has been wonderful. I think you are, this thing, communication to the world, and you've done that very efficiently. And Branded, all of you over here, I know that we are not very easy people to work with. We're very challenging. So thank you for staying, the course with us and presenting this so beautifully. You've done a wonderful job. Avian, I can see the leverage of this conference on Outlook and the times and everything already. Today, another press release is going out, and I know this is really going to be, out there in the media. So all you participants, all of you, do stay in touch with us. Thank you very, very much. I'm sorry if I've missed out anybody. This has been such a big exercise, and all various moving parts and everybody coming in, to do their bit. The whole Arogya team. Sushila, thank you for your constant guidance. All of the whole team of Arogya for encouraging the healthy workplace team. Thank you so much. And I know this is very difficult today to keep out from whether Biden is winning or Trump is winning, but thank you all so much. Over to you, sir.
Thanks, Sumati, and a big thank you to you too. This indeed has been an eventful day. Today's event almost had it all, right? From the journey of Arogya World Health workplaces to mental health, a lot about what corporates could do about wellness, the NCD prevention, and of course the best practices. We are sure this will help everyone out here to reflect what can be done and carve out a plan for a way forward. And thanks once again for being part of this event and creating a day with so much of enriching experience and a lot of learnings to take back. And of course, this is not a marathon. This is indeed a marathon and definitely not a sprint. So we need to ensure that not just spurts of enthusiasm is going to solve all these issues. To make fitness a way of life, I think it's a lot about running that marathon itself. So take care, and I'm signing off, Soumya Prabhakar, for today. Thank you so much for being there.
Bye.